Okay, you guys probably all heard that. So we're recording now. So thank you guys so much for coming to our first day of our 2-day webinar series, Special Education Transitions. This first one is going to be called Navigating the Transition from Preschool to Kindergarten for Children with Disabilities. I'm Paige Fitzgerald. If there's another person, just let them in. I am Paige Fitzgerald, and I'm joined by my colleague, Kate Magaldi, and we're excited to walk you through this key transition period.
So we know firsthand how overwhelming the stage can be. Today, we're going to help you understand how special education shifts from pre-K to kindergarten, especially when it comes to services, IDEA, and IEP goals.
Yeah, and most importantly, we're going to talk about how you can stay informed and empowered during this time. So before we jump in, we're just going to share a little bit about ourselves. One second, please, switches. Okay. So we are educational consultants offering training, advocacy, and interventions for families, parents, and schools supporting neurodiverse children. We specialize in executive functioning, helping identify strengths and challenges while providing practical strategies to support growth, independence, and success at home and in the classroom. I am a certified special educator. I have experience working in New York's District 75 in an autism classroom. I've also worked closely with families that have children of all abilities. I am a COPA trained special education advocate, and I'm actually a mom to 2 boys, one of who has an IEP. And this presentation is near and dear to my heart because he is actually doing his pre-K to kindergarten transition for his IEP in May. So this was even helpful to me as a presenter because you get to kind of go through all the things and get a nice refresher. So we're gonna get into some hopefully really helpful information, and for parents that are making this transition in September, or maybe it's going to be a couple of years until you make the transition, we hope that it's really something that can be helpful for you.
I'm Kate Magaldi. I'm also a certified special educator, formerly the special education chairperson and coordinator in New Haven Public Schools. And now I'm focused on private education and family advocacy. I'm a mom of 2 boys, a third grader and a sixth grader, both with very different learning profiles, which is important as we go through these next couple of slides. And Paige and I just came together with a shared mission. We want to provide inclusive, practical support for families navigating the special ed process. Okay, so we're going to start here by exploring how services can change between preschool and kindergarten. Preschool special education tends to be more developmental and flexible. Kindergarten, on the other hand, is rooted in academic expectations and very different from when I was a child and when Paige was a child. There's no more nap time in kindergarten. It's very academic focused. In preschool, your child may have been receiving speech or maybe OT or special instruction in a separate or mixed group setting. Often the emphasis is typically on play and routine. Um, and now, Paige, you're going to talk about what happens in kindergarten. What changes when we get to kindergarten?
Yeah, so once they enter kindergarten, the focus shifts to meeting grade level standards. Services are still individualized, but they're more structured. They're aligned with the classroom curriculum now, and they're often delivered in the gen ed setting when possible. While in preschool, your child probably was receiving services either through an IEP that was tailored to their preschool goals, or if they were receiving early intervention. Some states will still allow you to have that individualized family service plan, or an IFSP. And so when you're getting ready to transition into kindergarten, their plan is going to shift either to an IEP if they still qualify, or they might have a 504 plan, or there's a possibility, depending on their needs, that they might not be eligible to receive services. So they might instead just receive some classroom supports outside of a formal plan or through response to intervention or RTI. And then, so we're going to have a quick comparison really quick. We'll just go through these.
Yeah,
Mhm.
so I'll start. So the area of focus, we're going to start with preschool. The area of focus in preschool is that you're focusing on developmental milestones, whereas in kindergarten, you're focusing on academic performance and your functional needs. For curriculum, like I said before, is very play-based, is very flexible. There is a routine, but it's focused more on play and imagination and all that. Whereas in kindergarten, it's very standards-based. I'm sure you've heard the lingo, Common Core. That's the standards that all kids need to be following in different states. The service model for preschool is there's a pull-out model where the child is taken into a special like a little classroom one-on-one, or maybe even like in a small group setting, push in where the special education teacher pushes into the classroom and is joining the regular class, or co-teaching where the special education teacher and the gen ed teacher work collaboratively. In kindergarten, the service model is primarily school-based and integrated, where again, a lot of co-teaching should be happening, a lot of special education supports and collaboration with the special education teacher and gen ed teacher.
And which this is actually, I feel, one of the nice things about the transition, because if you're like me and we have our son in a private preschool, because of that, his services we have to go outside of the school for, and it's after school hours, and for a little kid that can be a lot. So with a public school, if they're getting those services in the school, they're now going to get their OT, PT, speech inside during school hours, which can be really nice.
The disability category for preschool is when your child is identified as needing a IFSP, Individualized Family Service Plan, you are identified as a preschooler with a disability. So it is typically a developmental delay in an area of academic, um, uh, behavioral, or speech language. That's Part B, 619 through IDEA. And then kindergarten, you must qualify in one of 13 IDEA categories. And we're going to get into this in a little bit, but there are 13 categories that your child could be labeled as. Back to the preschool, typically, as we said before, if your child continues services from preschool to kindergarten, you either continue on with a now categorized 1 out of 13 IDEA category, or you may or may not go to a 504 plan or not qualify at all. So we'll talk in depth about that in a little bit. Lastly, the staff that is involved, preschool teachers and service providers are in the preschool, whereas in the kindergarten setting, there's special education teachers, general ed teachers, related services, and those can be, like we said before, collaborated with a special education teacher, or depending on the model that the child needs.
Yep. And then also just one of the transitions is you're going to go from the CPSE, which is just preschool special education, to the CSE. Depending on how big your district is, that might mean that you're still talking to the same people, except in a different capacity. But if you're in a larger district, that might also mean now you're building relationships with newer people from the special education committee. And then for transitioning, you're going to continue through school years until either they graduate high school or they age out at 21. Okay. I'm gonna go to the next one. Okay. So we can't talk about transitions without talking about IDEA or IDEA. If you're receiving services under early intervention right now, we're going to go over that a little bit. And we're also going to go over Part B, which actually has 2 sections for preschoolers and for ages 5 to 21. So,
and we did our best to really break up what these acronym names are. And we know that's really a challenge for parents with children that have been newly identified. So if at any time that you need some clarification, you can put it into the chat. But we did our best to kind of break those acronyms apart to make better sense of what we're talking about.
Yeah. And we're going to try our best to keep the train moving so that we can have some Q&A time. So we'll see how it goes. I think we timed it out. Okay, we'll see. So IDEA, or the Individuals with Disabilities Education Act, is the federal law that governs all special education services in the U.S. It ensures every child with a disability receives a free, appropriate public education, or a FAPE, in the least restricted environment, or the LRE. You're going to hear FAPE and LRE so many times during your child's educational journey. You will probably reference it yourself many times during these meetings. And good to know for least restrictive environment. Sometimes you'll hear schools say, well, this is the least restrictive environment for your child, and they'll be talking about like an ICT classroom or something. So like Johnny's least restrictive environment is an ICT classroom, and that's actually a really inaccurate thing to say, but you might hear it because the least restrictive environment is always the gen ed classroom, always. So LRE, least restrictive environment, it's always going to be the gen ed classroom. There's no least restrictive environment that is specific to one child's need. So you're always trying to see, okay, what is the setting that we can get my child the closest to or in, right? So the least strict environment should always be the goal, barring specific needs. So IDEA has multiple parts, but for today's conversation, we're just going to talk about the ones that are relevant to us. So Part C, early intervention, it goes from birth to age 3. It's provided through an individualized family service plan. It focuses on the family and developmental needs, and services are typically delivered in their natural environments like a home or a daycare. There's always that joke that early intervention has all the happy families, and then when you get to Part B, that's when there starts to be some little more issues. And part of that is because early intervention can be in your home, so you're very involved. You develop these really close relationships with the service provider. I know that we loved my son's speech therapist that came, and you really feel like you're so in the loop. And it can be hard in that transition to knowing exactly what's going on, exactly how they're doing, to now being like, hey, can I get an update? Hey, how do we communicate? So Part C, and also for Part C, you can also have goals for the family too. There's also a lot of like parent training and things that can be done. Whereas Part B, and for an IEP, it's all about the child's education. So services are provided through an individualized education plan. It focuses on children's educational progress, and the services are delivered in a school-based setting most of the time. There's always going to be exceptions, like during COVID, right, where things just weren't able to be done in the school. There were some children that had to get makeup services, and they had to get those outside of a setting, but traditionally it's going to be in school during school hours. So Section 619 is specifically for preschoolers with disabilities. It covers children from ages 3 to 5. And Section 611 covers children from ages 5 all the way to adulthood when they turn 21.
So your child may have received services under 619, but once they enter kindergarten, their services will fall under 611. And that's where we're seeing a significant shift because, as we said before, they now must meet an eligibility under one of IDEA's 13 disability categories. And there's a ton of information. We're kind of like condensing this and making it super concise for you, but there's a ton of information on our website and through IDEA. Just, if you could reference these particular sections that we're talking about. Okay, so let me go into eligibility changes a little bit more. This is the criteria for 611. So when a child turns 5, they now have to qualify for an IEP under the 13 categories listed in IDEA. As a category of a preschooler with a disability, it can no longer be used because now they're shifting from preschool to kindergarten. So here you can see up on the board right now the different disability categories. And I'm going to just talk about like what might fall under, because these are some of them are very broad, some of them might be intuitive, but the first one is specific learning disability. These involve difficulties in acquiring and using basic academic skills. Some of these examples, who could qualify underneath this? A child that has dyslexia, dysgraphia, dyscalculia, auditory processing disorder, a nonverbal learning disability. The next one is a speech language impairment. This category includes communication disorders, articulation, fluency, language disorders, difficulty that are using spoken or written language. OHI is a very popular one. This category covers health issues that limit strength, energy, alertness, include heightened alertness to environmental stimuli. So those are your kiddos that have the ADHD, the attention deficit hyperactivity disorder. But also under this category can be epilepsy, diabetes, asthma, heart conditions. I believe anxiety could even be one of them. Am I correct in saying that, Paige?
So anxiety could go under OHI. It might also go under emotional disturbance. I think it sometimes matters, one, how it presents, and then two, sometimes, um, just a really quick aside, sometimes a child might have multiple disability categories that they could qualify for. Um, but what they will do is they'll say, okay, which one is really affecting their education the most? So I see a question here. Do you know why autism is the only diagnosed condition on the criteria list? So I don't know a specific reason why that is, but if I had to guess, I would assume because it is one of those diagnoses where there is a bit of a broad umbrella. So there's a high rate of diagnosis for autism, and also, there's level 1, level 2, level 3. Whereas intellectual, and like that is a known cause, so they can put it on there. Whereas intellectual disability, there's a bunch of things that could qualify as intellectual disability. I'm also sure that just to make the categories a bit more concise, would be why they didn't list every single disability, because I mean, there are so many, right? There are hundreds. And I think it can become a little bit confusing if schools, had to go over like, okay, well, it's this, but we don't see that as an intellectual disability because they're not presenting as this, or so I think that's why, Teresa, I think that's why. So it like, so for Down syndrome, you might not have, there might not be intellectual impairment where they would qualify under an intellectual disability, but maybe that person with Down syndrome might have an emotional disturbance, or they might have severe ADHD, and they would qualify under an OHI instead. So that's why I think too, and it's always a good question to ask, and you're going to sometimes see schools, like I know a child who is autistic, and he has an IP, but it's not under autism because they decided that it was going to go under OHI for ADHD instead, because they just want to see what's impacting. And I'm going to go off on another little tangent, but just emotional disturbance, kind of a little bit of an archaic word. We now call it emotional disability. And I think that's helped with the diagnosis, to take away some of the stigma, because obviously you don't want to put emotionally disturbed for a child. And that would sometimes stop parents from accepting an IEP label and eligibility because they were worried that how that would impact. So hopefully that can get changed to emotional disability soon. But right now, in IDEA, it is still emotional disturbance, unfortunately.
You kind of covered, no, you kind of covered, whoever asked that question covered, the autism spectrum disorder is its own category. Underneath that, as we know, autism is a huge umbrella. Asperger's, pervasive developmental disorder, not otherwise specified, and the different levels, level 1, 2, and 3.
And Asperger's, it used to be what it was called. Now they do it more as levels, like level 1, level 2, level 3. But I still feel, and I still run into parents who still compare it like, oh, it would be kind of like at a level like you would equate to like Asperger. So it's still kind of in people's language that they're using, but just for diagnosis, they don't do it anymore.
The next number 5 is the intellectual disability. So there are different levels. This is characterized by significantly below average intellectual functioning. And that is from mild to moderate to severe or profound intellectual disability. Down syndrome can be categorized underneath here. Fragile X syndrome is also. The next one is emotional disability or emotional disturbance, as it's still labeled here, which is a condition of showing more characteristics over a period that adversely affects the educational performance. So this could be anxiety disorders, depression, bipolar, OCD, oppositional defiant disorder, conduct disorder. And again, all these things have to be impacting the educational curriculum. Number 7 is developmental delay. So it is used for younger children, typically birth to age 9, when a specific disability cannot yet clearly be identified. So when your child is in preschool and they're showing signs that they are delayed in one of the areas, they will not have a specific category that says, oh, they are autistic or they have a learning disability. It will be a preschool with a developmental delay. But the areas of these delays could be a physical development, cognitive development, social emotional development, or adaptive behavior. Number 8 is multiple disabilities. This applies when a student has more than one impairment, and the combination can cause severe educational needs that cannot be addressed with addressing each disability separately. So examples of this could be like an intellectual disability and also an orthopedic impairment, autism and deafness, cerebral palsy and a visual impairment. So this is called multiple disabilities, also known as global disability or global delay. Number 9 is a hearing impairment, which includes deafness. It's a hearing loss that adversely affects educational performance. So deafness, hard of hearing, or a central auditory processing disorder if it is not classified under speech language disorder. We're almost done here. Orthopedic impairment is a physical disability that adversely affects the academic performance. So this could be cerebral palsy, muscular dystrophy, spina bifida. An amputation could even be under this. Number 11, visual impairment, including blindness. This is vision loss that affects learning even with correction. So partial sight, legal blindness, optic nerve hypoplasia, all of those can fall under there. Number 12, traumatic brain injury, TBI, is a brain injury from an external physical force causing a functional disability. So like a skull fracture with a cognitive impact, a car accident that somebody had brain trauma. Sometimes a concussion actually can be a cause of this, and it has long-term effects that can impact the child's ability to attend in class. And the last one is deaf blindness, which is hearing and vision loss causing severe communication and educational needs that cannot be met with the services helping only one sensory impairment. So this is something called CHARGE syndrome, Usher syndrome, and any other genetic condition or infection that can lead to both of those sensory losses. So that's it in a nutshell. If anybody has any questions to talk a little bit more in depth about them, we can.
So we're going to move into the changes in service delivery. This one's going to kind of be quick, but preschool services, they often happen in small group settings, special classrooms, or in flexible environments like a daycare that also offers preschool. In kindergarten, your child's IEP is going to describe where their services are delivered. They're going to either say gen ed, a separate classroom, how often and how long the services will be, and what support staff are involved. You're going to want to know your child's IEP inside out. Especially how often they're supposed to get it, how long it's supposed to be, where it's supposed to be, just to make sure that they're getting the services that they need and they're getting it in the way that they're supposed to be getting them. You might hear new terms like push-in services, and we touched on that a little bit before, but that's where the providers are going to work with your child inside the gen ed classroom. Sometimes this is really great and it can align to their goals, especially if, like for speech, it's participating in group discussions. That's ideally a push-in service, and sometimes OT. There's some hands-on activities that they can be doing, and you're going to talk in that meeting of if it's appropriate for a push-in. You might ask for a push-in, or you might hear that it's going to be a push-in, and you might question why. And they should have really good reasoning of why it's going to be a push-in service. You might also hear pull-out services, and of course, that's where they're brought to a separate room for therapy or instruction. That's usually the case for PT, for physical therapy. It can be for speech as well. You're going to hear co-teaching possibly. So where special ed teachers working alongside the classroom teacher. Oftentimes that'll be an ICT classroom, an integrated co-teaching classroom. And you're also going to hear about, is your child's going to get one-on-one services? Chances are the services that they were getting in early intervention most likely. But preschool, they were probably getting them one-on-one. Maybe they had some small group, but you're going to see in some cases, they're going to say, well, we think that it would be good. And, instead of doing it one-on-one, that we want them to have small group. And you want to make sure that there is valid reasoning for that. So that makes sense, especially when it relates to their goals, because let's just all be real and open and honest, right? There's staffing shortages in schools. Some schools contract out for speech therapists and OTs and PTs, and they're trying to make the most of their time. Valid for the school, also not your problem. So make sure that if your child has one-on-one for one of their services and they're saying, okay, like, hey, we want to either push the time down or we want to make it in a group, make sure that that makes sense for your child's goal and that they have really coherent reasoning for why they want to make it into a group, because group sessions can be wonderful for kids depending on what their goals are, depending on how they function in a group. If social skills are a part of their goals, that also might be nice, but you just want to make sure you don't have to agree to changing the from, group to one-to-one or one-to-one to group if you don't agree with the reasoning. You have that ability to ask questions, push back, say, okay, well, how is that going to help them reach their goal faster, right? Like, how is that going to benefit them, this change in service? And there's my tangent on that, guys. So remember, the goal is always to support your child in the least restrictive environment possible, meaning with their typically developing peers to the greatest extent appropriate. And I always say, especially if your child is going to be placed in a self-contained classroom within a gen ed school, you want to ask, and you have the right to ask, okay, so when are they getting to socialize and interact with their gen ed peers? Oh, it's during lunchtime. Okay, great. What does that look like? Does it look like all of the kids in the self-contained classroom are on one side of the lunchroom and then all the kids in gen ed are on the other side? Or is it truly where they're mixing among themselves and they're sharing a table and they're getting to interact and have novel, interesting conversations with their peers? I've seen it both ways, guys. So you want to ask these questions like, what does recess look like? What classrooms do they get to have recess with? What does gym time look like? They might have a specialized gym, but ask. You want to make sure if they're saying that it's an inclusive environment and that they're going to be with their peers to the greatest extent appropriate, you want to hear how that looks like when it's put into action. Because like I said, guys, I've seen it both ways. Some schools do a really good job, and some schools, the classrooms are in the same building, but they're not doing a really great job about getting the kids interacting with their gen ed peers. So just ask those questions. So this is why the IMQ is so important, because it's going to lay out the blueprint for all of this, right? It's going to say what their services are, what they should look like, how and in what scenarios they are going to be, in one-to-one or small group situations, and how they're going to be mixing with their gen ed peers. So be informed, ask questions, and if you don't like the answer, you can say, I'd like some more information on that. I don't think that fully answered my question.
Never be afraid to ask questions. You are your child's biggest advocate, as you know that. So it's never somebody, we don't expect anybody to be taking the back seat. Ask the questions, be informed, and when things don't make sense, just keep going, because it's going to provide a lot of clarification. Okay, so we are talking about your role in the transition process. So let's talk about the IEP meeting for kindergarten. This is a key moment where the team, including you as a parent, creates a roadmap to support your child's success in school. It outlines goals, services, and accommodations where your child will need what they will need in their new environment. And as I just said, parent participation isn't just encouraged, it's actually a legal right under IDEA. You are a core member of the IEP team, and your insights, your questions, your observations, all of those things are so imperative to share with the team, because you are collaboratively working with a team to help shape the services that your child receives. So if you're holding back and you know that your child has been pulled out in the past and they had a really difficult time transitioning back into the classroom, you have to speak about that. Share that wealth of information with your team, because any bit of information, especially when they're starting to get to know your child for the first time as well, those things are so important. Many times, like my son was receiving speech in preschool, and he transitioned to his elementary school with an IEP. For speech, and many times the public preschool that's affiliated with our town were part of the IEP meeting. So that also can sometimes be the case, and that's really helpful if the team from before was able to share some insights as well. But you are a vital piece. Don't forget that.
Yeah. And before the meeting, you might be asked to fill out a parent input form or to share your thoughts in writing. And this is a great chance for you to communicate what's been working well in your child's preschool, any concerns you have about kindergarten, what kind of environment helps your child thrive, specific skills that you'd like them to develop. And um, sometimes some districts, I know my son's district just did that. They have a kindergarten readiness day for children coming into the school with IEPs. And that's where they kind of do a little bit of their own testing just to see for those kindergarten skills where they're at, where they will need support. I had to fill out a form saying what I thought my child's learning style was and where I thought they might need support and also where they excel. So hopefully your school district will be doing something like that. I also always tell parents of children of any age level when you're going into an IEP meeting that it's good to email them a parent agenda. So things that you would like to, oh, I'm just going to admit someone right here, that you would like to talk about in the meeting, because also IEP meetings can sometimes get a little emotional, or you might be talking about something and you could get a little bit off track. So it's nice to have your own agenda as a parent just to make sure that you're getting all of your concerns addressed. You can always, during the meeting, ask for clarification on any terms or goals, and you can suggest strategies that you know work well for your child. If you're in a district that is really good at parent communication, you'll hear things like that. Well, especially for the young kiddos. Okay, so when you see this behavior, because we see this behavior down here, what's something that you do that can work well at home? You can ask and should ask how they're going to track the progress. Anecdotals, I'm very iffy on that depending on the goal. You really want to see that they're getting some good data on how well a student is doing. We'll get more into SMART goals in a minute. You can request that any proposed goals or services align with your child's needs, and which they should be. If they're really good goals, they should be aligning with their needs. And you also have a right to ask for parent training as a part of your child's IEP. So it's a little bit different than an IFSP. They're not making goals specifically for the family or the parent, but parent training is one of your rights under IDEA. So just for example, we had a client who her child had it was a mix of disabilities, but there was some behavioral issues. So the child had a BIP, and part of their request for parent training was that they wanted to have the training on behavior intervention and strategies that they could do at home. So they got, I believe it was once or twice a month, they got to meet with the school psychologist for maybe 15 to 20 minutes, and they talked about different strategies and techniques that they could use at home. So you are entitled to parent training as it relates to your child's disability and how you can support them in their needs. So that's something that most parents don't know. And surprisingly, what I found out during our journey in advocacy is that it's sometimes something that's people like teachers won't know. I once had someone say, I have to ask about that. I don't know if that's allowed. I'm like, trust me, it's allowed, but go ahead and ask. And of course it was allowed. All right, so let's go to the next one. There we go. Okay, so we're going to talk about SMART goals in an IEP. I forgot that this one was right next. So it works well with what I just said about talking about SMART goals. All right, so SMART is an acronym, and it stands for specific, measurable, achievable, relevant, and time bound.
Okay, so let's break that down a little bit. So for specific, is the goal clear and well defined? Because it should tell us exactly what the child will do. So an example, it's not just going to say like improve reading, but specifically identify beginning, middle, and sounds in CBC words. Measurable means, can we track the progress in numbers or observable behaviors? We should be able to answer this particular question. Did the child meet the goal? So example would be like 4 out of 5 opportunities or 80% accuracy in 3 consecutive sessions. They're very specific, measurable goals. The next one is achievable. Is it realistic given the child's current performance and the supports that they have? Goals should not be too easy, but they should set a child up. They should not set a child up to fail either.
So, and just to jump in on there too, especially for something like reading goals, or if you have a child that's trying to correctly identify a lot of words, sometimes if they're using like the ABLES R assessment, so they might be trying to identify or match objects, you're probably going to see teachers, not all teachers, but be a little bit conservative because they don't know your child very well. So they might, I've walked into IEP meetings where it was like, we'll identify 10 novel objects in the school year. And they're doing that because they want them to hit that goal. And it's okay to say, you know, based on what I know of my child and their skill acquisition, and also to want to push them a little bit, let's bump that up. That doesn't seem like enough of a challenge. Because guess what? Towards the end of the year, if they aren't hitting that goal, they might modify it then. But let's set the bar a little bit higher in the beginning of the year so that there is that expectation of excellence for your child and that they can really get their full potential. So, you know, you want to just right goal, you want it to be realistic, and you want it to be a bit of a challenge. And for kids that are in a gen ed classroom and with goals, I will often ask, okay, well, what is the standard for the rest of the class? And okay, is it realistic to have him meet that goal by the end of the year, or even meet, you know, their mid-year goal if he's significantly behind? And it can really open up a nice dialogue with teachers as well of like, oh, I didn't even think about it that way. Yeah, you know what? Let's put the goal that he'll be where the class is at the end of the year because he's getting this service and this service and this service. So I think he can do it. So it's just nice, once again, to just ask those questions. And if you want to know, well, why is it this when the grade level standard is this, or why is it only this many? What's the reasoning? Because sometimes it's just them being a little bit conservative with the goal for a child that they're unfamiliar with.
Which leads us to relevant, exactly what Paige just said. Does the goal relate to the child's identified needs in the classroom or their developmental functioning? For instance, social goals for a child with pragmatic language challenges. And the last one for T is, next one is time bound. Does a goal include a timeline? So IEP goals are typically written for one academic year, but benchmarks and short-term objectives, sort of what Paige was saying also, may be added for more complex skills.
Yeah, and usually when they have those benchmarks and those short-term objectives, you're going to get those quarterly sent back, and it'll say, did they meet this? Are they on their way to meeting it? Is it looking like they might not meet it for the year? And if you're seeing that might not meet it, that could be time for you to ask for a meeting and say like, hey, what's been going on? Because usually then they have to be either changing up the way that they're trying to teach the goal, or if it's, you know, mid-year towards the end, maybe rethinking the goal for that year. Okay, so we're going to look at a goal together, and we're going to decide if it is a SMART goal. So Maya will improve her handwriting. So just from everything that we've learned so far, it's probably going to be not a surprise. I was so excited when I got to see that this little dancing emoji, but it's no, it's not. It's not a SMART goal.
Can you measure that?
It's
what does that mean? What does that look like in the classroom?
Yeah, and we walk into meetings and we definitely see this often. So for a SMART goal, it's going to look like something like by June, Maya will independently write all lowercase letters with correct orientation and placement in 4 out of 5 samples as measured by weekly writing samples. I repeated myself a little bit, but it's fine. So you want it to be that SMART goal. Okay. All right. And also, if you're unsure, you can just ask the team to walk you through the goal using the SMART framework. Hopefully, schools will know what the SMART framework is. I feel like we've come leaps and bounds. Most schools are trying to make them fit into that framework. And always remember that you're an equal part of the IEP team. So if something feels off, you can ask for another meeting. You can request a draft in advance. Sometimes that's okay. Sometimes schools won't do it, but they'll have conversations and you have the testing, and you can always bring someone that you trust as a support person or an advocate. Do you want to go over things to remember real quick?
Things to remember. Yes. Transition meetings should happen in the spring, which is why we planned this webinar specifically for them. Review evaluations ahead of time. So be familiar with what your child's scores were, highlight things, jot little notes on the evaluation so that you can bring it to table with any questions that you have. As we said before, don't hesitate to ask any questions. Your questions are going to help your child succeed. And if there's any gray areas that you are unsure of, that's what the team is there for. They're working in collaboration with you to make sure that your child achieves success. Um, Make sure the IEP includes all areas of support that are needed for your child. So it's not just academics, it's social skills, life skills, and behavior. We recently were working with a child who has dyslexia, and he just started acting out in the classroom. And there's something that we have to dive deeper. We have to figure out what's really going on for the child. It's not just, oh, he has dyslexia. He's struggling in that area. There's so much more that is impacting him. So they're going back to team and they're having evaluations done for social emotional. So you are your child's biggest advocate. I can't stress that enough. Please, reach out to them, ask questions, come to table, collaborate with the team, and just feel like you're working together with them to achieve success for your child.
Yeah, absolutely. So we also wanted to share that we made the advocacy toolkit for parents, and it is available on Amazon. So essentially, we've had so many conversations with parents that usually would just start like, I don't even know how to phrase this request, or I don't know if this is a valid concern to have. And we wanted to make something so that parents could really feel, like Kate was saying, like they're active participants, like they are empowered. So the thing that the advocacy toolkit has, it has so many things, but one of my favorites I always say is the templates for writing, because it gives you that exact language that you can use and you can customize it for your specific child. And all of it is just, it's friendly, but it's written in a way that is aware of your rights. We also have a section that goes through some common challenges, right? It's a long time from kindergarten to all the way to high school graduation. And we always hope and wish that it's smooth for you guys and that you don't run into any hiccups, and the hiccups that you do run into are quickly resolved. But just in case, we have a whole section on common challenges that you might run into, as well as resolution procedures that you can do. Like, special education right now, it is in flux. There are so many things that we won't get into, we wouldn't even have the time to get into, that are up in the air and changing. So we wrote this of how things are in 2025, and hopefully we'll continue to update things as things change. But we also have a wonderful section that I use for my own son's meeting, in the preparing for school meeting section. And it lets you have notes, and it lets you track all the things that are included in your child's IEP and the concerns that you have. And
Step-by-step guidance.
Yeah, and that actually just reminded me, just like another quick tip for parents, that you're going to have these meetings, and it doesn't matter what kind of meetings that you have, but they're going to be things that you agree upon, right? Of course, hopefully not so many things that you disagree upon, but you always want to leave a paper trail. You always want to have it written down, because unfortunately, Zooms, in-person meetings, phone conversations, there are sometimes promises made that are not kept. And we've had many parents come and say, well, I was promised that if I switched my child to a more restrictive setting, and if it wasn't the right place for her, that she could just go back. And then they realize that actually now there's all this red tape and their kid is in this placement, or they have their one-to-one and they said, okay, we're gonna take it away, but if they need it, we can get it back. And then all of a sudden we're fighting for the one-to-one to get the one-to-one back. So you always want to write a very friendly follow-up email immediately after whatever kind of meeting or conversation that you had that wasn't written down. And you want to just say, thank you so much for your time today. I really feel like we're on the right way for so-and-so's education. Just to sum up what we discussed. We discussed that XYZ would be implemented here. We discussed this. I addressed my concerns for this, that, and this, and I'd like to maybe schedule a follow-up meeting to go over them a little more, because I don't feel like that was resolved. It will save you so much time and headaches. You might still have a district that says those emails don't exist, but they do exist, and you can use them. So that's one of my biggest tip, is just write it down. If you had a nice conversation and hopefully you will have a wonderful relationship with the school. There are many wonderful school districts out there. But it's just always good always good to write things down.
I just want to jump in because you
Yeah.
shared what your favorite thing for our advocacy toolkit is, and mine is the glossary of all the terms because I know that that is so overwhelming to many parents, especially when you're going from preschool to kindergarten. So there's a glossary of all the different acronyms and what they mean. So hopefully that's helpful to the parents as well. So this is available on Amazon in book form, but we also have PDF version on our website. So you can head to our website for both of them. There's links to both.
Yes. Oh, and sorry, also here is the
And there's a link. Ta-da!
I just love that first page so much. I forgot about the second. So if you're interested in the advocacy toolkit, you're more than welcome to scan this QR code. You can go to IU Practices if you would like to inquire about working with us there. We also have, I think we have a couple of resources on there as well. We're going to be presenting tomorrow on executive functioning skills for middle schoolers, I believe. And there is a free executive functioning skills checklist for kids and parents, which is really helpful. And you'll learn more about why for that tomorrow. But we've got a few minutes until our next presenter, Dr. Divina Lopez, who we love and we're so excited for. But if anybody has any questions for us now, feel free to put them into the chat. And then we would be more than happy to answer them. Otherwise, we will just take a brief pause and we'll get Davina set up. Let's see the message. Oh, thank you so much, Teresa. I really hope that was helpful. And obviously, if you have any other questions, we'd be happy to answer them. Thank you.
Thank you, Teresa.
Davina, really quick, I'm gonna unmute you, Davina, just so that I can help you set up. And then if anything else pops into the chat, I will, of course. Okay. Davina, can you hear me?
Yes, do you hear me?
I hear you, yes.
Good morning. Good morning. How are you?
We're so excited to have you here. We just finished up a really nice session, and I wanted to ask you, would you? Oh, now I can. Oh, wait. I was like, now I can see you. No, I can't. It's Kate.
Sorry, I was going
I see both of you ladies.
Would you like?
There you are.
Yeah.
Would you like me to share your presentation, or would you like to share it? Because I have it up and ready, but you can also completely take control if that's what you would like.
Yeah, you could go ahead and just share it because I have a million tabs open.
Okay. That's why I share my presentation beforehand, because I've got tabs on tabs on tabs.
That overwhelms me.
I was gonna say, every time I share my web browser with Kate, I think I give her like the sweats.
I know most people, when I share my screen, they're like, how many tabs? And I'm like, I have ADHD. This is normal. This is how I function and this is how I work.
Yeah.
And I don't want to close my tabs.
Yeah, I mean, a fellow ADHDer here. So I'm like,
Yeah.
this is my process. The tabs remind me that
Right.
it's there. And it's helpful to have the tabs open.
It keeps me accountable. So I want to keep my tabs open. And that's just how my brain functions. And I love it. And I'm okay with it.
I have my tabs open, and if there's like 10 tabs up, I just have to press X for all of them to go away and start fresh.
Yeah, that gives me anxiety. When it's too clean, I'm like, wait a minute, I know I'm forgetting something. Yeah. So I like to have it all there where I can see them and like click back and forth, and I'm okay with it.
Hey, really quickly, I see a chat, but it's not letting me see anything. Or is there a question there that I'm not seeing?
I just wrote back to Teresa is planning to share the info with our toolkit with her mom's group. So I just wrote back.
Oh, thank you so much, Teresa. That's so sweet. Okay, yes. You might have to keep track of the chat because for some reason it's not letting me.
I can
see it. Okay. So I think maybe we will just wait a couple of minutes.
Yeah, we have 5 minutes.
Yeah, so we'll just maybe wait a couple of minutes in case anyone jumps on, just so that we can be starting around the time that we set for this. And then, yeah, so this is a great time, gang, for a bathroom break, a coffee break, a little snack. I'm gonna sip my tea.
I know. Do you want to make her presentation in present mode?
Yes, yeah, I do. Yeah.
Look at that.
Yes, I do. Yeah, that's a good thing.
I'll be right back.
Yeah, no worries.
There we go. Awesome.
Oh, no, I'm going through it. I'm starting to click through it without her.
I just got a couple other emails that two more people asked whether or not they can have recording, so that they were planning on doing.
Yep. So this is all being recorded. So we are going to be sending the link for the recording out to everyone that registered. So I mean, I think for the most part, everyone has registered, but in case you got this link from someone and you didn't actually register on the website, that's actually a really good point. Just make sure to go to the website and just put your email in for registration so that it can be sent your way.
Yes.
Gonna check the waiting room and hopefully not move this thing.
What's that?
Oh, I said I'm just gonna check the waiting room, but hopefully not keep moving her presentation. That's what I was doing before.
We just have 2 minutes and then we can start up. As soon as Divina comes back, we probably can start.
Hey, while we're in, can you send something in the chat? I just want to see if it's gonna pop back up for me, or I don't know why it's doing that.
You can't see anything?
I can't see anything anymore. I was able to see it the whole time, but okay, chat. Okay, now I see it. I don't know why I did that.
I don't know.
No, that worked. Okay. Davina, if you're ready, I think you can start now if you'd like. And then just feel free to
1 minute spare. I'll do a nice introduction.
Yeah.
We ready? You're good to go, Divina?
Oh, let me ask you to unmute. Hold on. Okay.
Do you hear me now?
Yes.
Okay.
All right. Yeah, let's go.
All right. So we have Dr. Divina Lopez, a board certified pediatrician and an autism mama. We actually met Divina through a mutual friend, and it's been a gift to learn from her ever since. She's an active Instagrammer, and we follow her journey with her son. She brings a plethora of knowledge, and today she's going to be guiding us through the world of birth to three. So thank you so much for joining us today, Divina.
You're welcome. Thank you for having me. I always love talking to parents because, I know how much we love our kids and how confusing all of this is. And oh my goodness, sometimes it just feels so overwhelming. And we always want to make sure that we're doing all the right things for our kiddos. And so, a little bit of background about myself. I am a board certified pediatrician for almost 20 years now. I still can't believe that. But I really became absorbed into this entire journey after having my son, who is on the spectrum, and he has ADHD, and he has auditory processing disorder and visual processing disorder. And boy, has it been a journey. And he is now 12 years old. And we've been through preschool, elementary school, now we're in the middle school years. And as a pediatrician, I want to say, like, we do not get enough training in any of this. So people always think like, oh, you're a pediatrician, of course you know all of this stuff. And I think that I bring a unique perspective because I am a school doctor as well. So, you know, my love of, I think, the school age years happened, of course, you know, after this whole process. But, you know, I adore my newborns and my toddlers. And, you know, those are such formative years, right? So there's so much going on. There's so much brain growth happening. And parents are so curious about their little ones. And, you know, as pediatricians, when you come into the office for the checkups, we're always doing a lot of questionnaires. You know, the most, I want to say, common one that you'll see during those early toddler years is the MCHAT, and that's where we're asking a lot of questions about their development. And hopefully you're keeping track of, you know, what is going on while you're at home, so you can answer these questionnaires really well. Because the way I see medicine has changed after the pandemic is that things seem to be more rushed. I have noticed a lot of pediatricians are having shorter visits with their patients, unfortunately, and there's a time crunch constantly. And if you are not paying attention to the way that you answer those questions, they may not be picking up on certain things on time. And the most important thing is to have services and support early on, especially during those really early years, because that's when brain growth is happening so quickly. And we want to make sure that we take advantage of that and get services started if we need it, so that our children can make a lot of progress, right? So don't ever be ashamed about, you know, if you notice some delay or regression. Those are, you know, definitely red flags for you to keep track of, and make sure that you are addressing them with your pediatrician. I also think that it's important to have good conversations. If there's anything that seems confusing to you, that you're actually like making time to have these conversations, because a lot of times, like I said, the visits are very rushed and they may not have the time to actually address the questions that you have. So you may need to ask for some extra time. So I always encourage parents to never be afraid of actually speaking to your pediatrician, even if you're not in the office. Call, ask when is a good time to have some extra time to speak with them to get all your questions answered correctly. And if you're confused about anything on a checklist, make sure that you're also just, you know, clarify what does this mean? You know, I want to make sure that I'm answering it appropriately. And so, you know, I do have a unique perspective, like I said, because I am a school physician also. So I read a lot of IEPs every single day, and there's a whole lot of material in there. And I know that a lot of times that's very confusing for parents. It was really confusing for me as well when I first started looking at them. And but there's a lot of good information in there. Okay, so let's get started with the presentation. The importance of early intervention is like phenomenal. People do not understand this part, and I really, this is why I'm telling you, like, make sure that you answer those questions correctly, because there are so many times where I find that the medical practitioners are not referring their kiddos to early intervention, and you're really missing a good opportunity there. And you know, you want to make sure that you capture this time and that you're using it. And when you have services available like this, you want to make sure that you're utilizing them, right? So the importance of early intervention is that it is started during that really critical time period, right? For some kiddos, if you were in the NICU for a certain amount of time, you get it like right from the start, which is great, but that's not the case for the majority of the kids who end up requiring some services from early intervention, right? And another thing that I want to tell parents is that you don't need a referral from your pediatrician for early intervention. You can call and have a referral yourself, and you can see whether or not your child qualifies for services. And the beauty of early intervention is that they can come into your home and they could like really teach you a whole lot of stuff. So even as a parent, I just think that it's so valuable because we can continue, we can get some good information from all of the services that they provide, and then we can continue them at home ourselves and, you know, help our children to reach their milestones. So it starts in that critical period for brain development from 0 to 5 years. It improves communication, social skills, and behavior. It reduces the need for intensive interventions later on. So this is what I'm saying. Like, you want to capture those really important years, those early years, because there's just so much brain development happening. Your cells are multiplying so quickly. Those nerve endings are happening, right? So you want to capture that time period. It's so important, and I cannot stress that enough. Like, sometimes when parents are asking me like, oh, should I get an evaluation for my child or not? And I'm like, what do you have to lose, right? What do you have to lose? If you get the evaluation done and you qualify for more services later on, wonderful. Why wouldn't you want that for your child? I think a lot of times there's a lot of fear, there's shame, you know, but what I want to also stress to the parents is that don't ignore your intuition. Intuition is a really important part of this. Like, sometimes we second guess ourselves, or our family or friends are telling us something else. Like, you know, I remember my mom telling me so many times, like, oh my goodness, he's so smart. Why do you think that he's on the spectrum? My son was a late diagnosis. He wasn't like many cases with autism where there's that speech delay. My son actually was advanced in his speech, and so, but he was really good at just memorizing everything and scripting and stuff like that. And people don't pick up that that's not real, like, back and forth communication, right? And so a lot of times those kids go undiagnosed until they're older. But so many times I heard from my own family and friends that I must be crazy for thinking that my son was on the spectrum. Like, you know, why would I want to label him like that? That was another thing that I heard a lot, like, don't label your child like that, or that I was overdiagnosing. And, you know, all of those things were constantly in my mind, making me second guess myself and doubt my own observations that I was making. And to be really honest with you, my pediatrician never picked up on any of those things. And he's a colleague of mine that I trust and that I respect. And every time I brought up the conversation about autism, he had more of a watch and wait approach to it, which I do not have. I am the sort of practitioner where I'm like, we see something, we address it right now, because again, like, what do you have to lose, right? If anything, you have everything to gain. And so we want to make sure that we do not lose time. Like, time is of essence here, right? We want to take advantage of those early years, and we want to make sure that we are giving our child every opportunity and every chance to have the support and the services that they need to succeed in life. Because when you start off these services early on, they do so much better. The progress is so much better, and you will feel and notice the effects of it pretty quickly when you start off younger. So it enhances family and child quality of life. Absolutely. You know, you will, like I said, you will feel more comfortable. You will feel more able to help your child, right? Because a lot of times we do feel stuck and we're not sure what to do. So don't stay in that period of like, you're basically like a deer with the, the headlights flashing. Don't stay there. You know, that initially does happen. That is part of, you know, the process of like what I talk a lot about grief as parents when we start noticing something going on with our child. And we want to really try to make sure that we don't stay in that stuck period where we're just like, oh my goodness, it's a little bit of shocked sometimes and we're scared, and the fear may hold us back. But early intervention does, it brings so much more clarity to you, and it allows you to be able to just be a part of like your child's growth in a different way, right? Where you're not just expecting the usual milestones. Now you're understanding that, okay, if there's some delays, we got to give some time. And, you know, there is a growth curve to all of this, but it's important to recognize that you may be on a different timeline, and that's okay. That is totally okay. Next slide. So the key areas of early intervention are speech and language therapy. I want to say that's probably the most common reason why people get introduced to early intervention. There's occupational therapy. I love occupational therapy. It's probably like my very favorite because they just do a plethora of different things, and they really help with a lot of like daily skills, and they do things in such a fun way that they really get to engage your children. And I just love I have a special place in my heart for occupational therapists. We can do some behavioral interventions, and this is a big one, right? Because we see so many behaviors being acted out in a negative way when the speech and language delays are there, right? Because there's just so much frustration. They want to communicate something and they can't. So then you may see these negative behaviors. And this may hold your child back from entering preschool or daycare. I see that on a daily basis. And so like ABA therapy and play therapy are wonderful because what they do is they really help those negative behaviors. They teach your child some positive ways to bring it out, and you you know, it's just, I feel like ABA does so many different things. Like we did it for about 2 years with my son, and I mean, they did everything with him. I was amazed by ABA therapy because I'm like, wow, we could do all of this with him. You know, I had some good experiences. I've had some bad experiences. I always tell parents, like, I think it's important to give the therapist time to get to know your child and for your child to feel comfortable with them, because you may notice a time period where it feels it doesn't feel natural, and they're really trying hard. And remember that everything is new for your child, and that you have to give them at least a good like 3 months of getting to like have some time with your child understanding like what to do for it to start feeling a little more natural, and where they appreciate it in a different way. Because at first it may feel like a little overbearing, but then it becomes like a real routine. And they will also teach you those methods as well. It helps your child with their social and emotional development. This is a biggie because, right, we go to the playground, we see that nobody's playing with our child. Our child is, you know, maybe, you know, having a hard time, doesn't even want to go anymore, right? Because they're not enjoying themselves and they isolate themselves. And so this is a really important time of their life, right? Those early toddler years, especially, where they're learning how to interact with their peers. This is a really important skill to learn early on as well. And then there's all the parent coaching and support. Like, why wouldn't you want that, right? Why wouldn't you want some guidance? Why wouldn't you invite some of that good information, just like you're receiving in this webinar, right? We're all like moms trying to help other moms because we know what this journey really looks like, and we understand the challenges that it comes with. So early intervention does do so, like they give so much information. They have so many different services and support. And I hope that as a parent, you appreciate it and that you understand. And, you know, even if you see somebody else that you may think may benefit from it, that you talk to them about it. And so in this slide, we're talking about the school readiness indicators. I know that parents are always like eager to get their kids into school, and they want to know like, when are they ready? Luckily, if you're already in like an early intervention program, then by their third birthday, they're getting your child into a school program that is appropriate for them. That's also really nice about early intervention. So again, like take advantage of it. Don't be ashamed or afraid to get services. It's really helpful. It's really helpful. So for the cognitive skills, so we're talking about like the brain development, right? We want to start noticing whether or not your child is like just basic counting and letter recognition. And so this is why we always say like books are so important early on, because we want them to start identifying all of those different things, colors and numbers and letters, right? Because you have to start building a foundation somewhere. You don't have to be you know, I don't want parents to pressure kids, because I think a lot of times there's this pressure of like time of like, oh my goodness, I have to do all of these things. I think that if it's just part of your everyday routine where you are incorporating maybe 5 to 10 minutes at first, like make it short and sweet, because you don't want to be like a parent on top of your child, like pushing all of these things. Make it fun, make, you know, have games, or I always loved flashcards. Those are like some of my favorite tools to use for studying, even for myself throughout my school years. I've always used flashcards. You know, while you're watching maybe a show or a video with them, you can point things out, or even when you're outside, just, you know, have a look at signs and stuff like that. Make it fun and make it part of your like natural everyday things that you're doing, right? For the social and emotional skills, we want to make sure that they are relating to their peers in some way. I think a lot of our children suffer a little more in this area, where they are more internalized, maybe like they're really into whatever their special interests are sometimes, and that may make it a little harder for them to relate to their peers. But make sure that you're showing a good example to them also if they have older siblings, cousins. You know, those may be the easier ones to get them to connect with first, because they may already feel more comfortable with those individuals. And so you want to start modeling for them. You want to make sure that maybe you're using their toys and showing how their toys can do it. But, you know, having a child show these sort of like skills is going to be really important for them for the, you know, entering into a classroom setting, right? Self-regulation is a big one. That one takes a little longer, a lot more patience. And we can use some really good tools like a teddy bear to help them in that way. Put it on their belly, let them breathe in and out. I always say show self-regulation skills when they are self-regulated. You know, when they are in that regulated state, this is your time to like capture some good information and model it for them. Because when they are in a dysregulated state, it's not gonna happen. Like, I'm so sorry, but parents are always like trying at that moment. I'm like, give it up, give it up. If this is just not the right time, they are not like appreciating any of what you're showing them. Instead, when they are in that dysregulated state, you really want to validate them and you want to be there for them in the way that they need you, right? We can't, you know, I would always like run to my kid and want to like hug him and squeeze him. And he's like, stop, like, you know, don't even touch me right now. And I had to learn how to respect his boundaries, because that was really hard for me. I'm a very like touchy-feely person, and in those moments when he's dysregulated, that's like the last thing he wants. He does not even want to be spoken to. Like, I just have to like, okay, here's a timer and here's like 5 to 10 minutes to yourself. Take your favorite video, do whatever you got to do. But you know, we're at that point now. And when I think about him in those early years, it was just full tantrum mode, which is really hard for us as parents to take in. And because we get really swept up in the emotions ourselves, you know, those could be like really hard times for us to manage our own emotions. And so I'm going to tell you, please give yourself a whole lot of grace, because if you're not doing that throughout these processes, it's going to feel like torture. And it's taken me years, and I'm still not a pro at any of this stuff. You know, I'm definitely better at it. But I want you to recognize, like, to capture moments of teaching when your child is regulated. Because then when they are in those dysregulated states, you could be like, hey, remember that breathing we did with your teddy bear? Can we try that right now and see if that works? You know, and really let your child start to become aware of what are the triggers and how do we manage it. And then try to avoid those triggers if you can. Because these are all really important pieces of information to share with the teachers and whoever may be in the classroom setting. So you want to like have all this information for them as well. So communication skills, right? We want to make sure that our kiddos can like advocate for themselves, right? So expressing needs is a really important one. Learning to follow directions is another one. Because again, if we don't have a form of communication that is effective, then you're going to see more of the behaviors. And I have noticed a lot of schools have been calling parents like daily because of the behaviors that they don't know how to manage. And then you're having to call out of work or come early to pick up your child, or sometimes schools are asking you to, you know, maybe find another school setting for them. So these are like big ones that I want to say you want to work on: the communication and the social emotional skills. Those are really, really big ones. Regarding independence, there's toileting, dressing themselves, attention span. Toileting is a big one. I think many schools have adjusted to this one. I never want parents to give up on toileting though. I had a parent this week ask me, when is the best time to start working on toileting, when her child is 3 years old now and not interested at all. And you know, this is always a really frustrating one for parents, because this is a method that children use as a control thing. Sometimes though, kids are not aware of the sensations. And so my first approach when it comes to toileting is allow them to start feeling the wetness, you know, like the discomfort of it, because they have to put two and two together. There has to be that connection happening in order for them to be aware enough to know when they need to go to the bathroom and to have a way to communicate that to you. So I think a lot of times when parents become very frustrated about toileting, there's even more regressions and delays in this area because you know it's expensive for us, right? And it's messy. And the best thing that I think I did for my child was I left him like naked for 3 whole days. I always tell parents, take 3 days off. Be home with your kid. Have nothing to do and nowhere to go. Keep your kid like naked. Put their like panties or underwear on, no diaper, and be like, I don't know what happened to the diaper. That's what I would every time my son would be like, where's the diaper? I don't know. I don't know where it went. I was like, I don't know. We don't have any. And you know, it did happen within those 3 days. And so you know, I've always told my parents, whether you're neurotypical or not, you know, just try that method, because it can be really successful, but you really have to be on top of it. Like this is one where you can't like be half in, half out. Like you have to be fully committed to toileting in order for this to be a successful skill for your child. Dressing could be like really early on, just asking when they're younger, like put one arm up and use the right terms for their body parts, please, you know, because people sometimes have like they have these cutesy terms. Please don't do that. Like, let's use the real you know, body part terms. I think that's really important. I saw a question, right? Something came in through the chat about toileting.
Yes, I think there's a question. So Lisa was asking, does that include not diapering overnight in those 3 days?
No, so we have to work on daytime dryness first. Don't worry about the overnight yet. Okay, so overnight could take like another year or two. All right, don't, you know, so be patient in that way. So I do allow the overnights, that I'm not worried about. The thing we want to master is the daytime dryness. So just learn that one first, and then you can work on the nighttime, because the nighttime I have a different skill to use, but and that one also doesn't need to take so long, but they need to master the daytime dryness before they can even think about the overnight stuff. Like overnight, we could give it another few years. So it's okay for them to wear like a pull-up overnight. And the overnight is very easy. It's when you start noticing that they're waking up with a dry diaper or you know, pull up, whatever you're using. That's when it's time to start doing the overnight. Okay, because their bladders will also adjust, right? And so when you start noticing that it is, you know, it's just the way the body works. So you have to allow the body to do its thing and to mature in the way that it does, and not try to do it before it's the right time. Okay, so in terms of attention span, that's a big one for many of our kiddos. You know, like I said, I still don't have a good attention span. Like doing an hour talk is really hard for me, because I'm already thinking about like, what am I gonna do next? And you know, what might they be asking me? I have a head full of thoughts all the time. And so when we're talking about attention span with a toddler, we're talking about like a minute, 2 minutes. Like we're not asking for 15 minutes of time. I think that's really being that's just not even giving them a chance. Like, let's not do that. When we're talking about attention span, we're asking them like, can they sit on the reading rug for maybe like 2 to 3 minutes while I read this quick little thing to them? That's what we're asking for. We're not saying like your kid, like this is not military. I'm not asking for your child to sit on that thing for 30 minutes. And that's totally not even age appropriate. And sometimes I get angry when I see some of that going on in the school setting. I'm like, let's not be military. Let's give them something else to do. You know, sometimes they need something to sit down. So there are different ways to address attention span, and it also depends on what you're doing, right? Is it a safety thing versus like it's just like part of the routine? Because safety, we have to know like this is the time where it's we don't have any excuses, and then this is the time when we could be a little more flexible, right? And then their physical development, like we have to know when is the right time for them to hold the pencil correctly, and you know, the coloring is happening. So those fine motor skills and gross motor skills are things that we work on like every single day, and you don't even notice it sometimes, right? Like learning how to turn a page on a book, learning how to point to something when you're asking, learning how to hold a crayon, because you know, there's just different there's a different like skill for each age, right? So we want to make sure that we're not stressing for them to be performing a skill when they're not ready for that. And so give your children time, they will get there. And I would also try to stress for you to have a positive mindset, because a lot of times we get so worried and anxious that we ourselves are not noticing when our children are making some you know, achievements, and I want you to celebrate those things with them, and I want you to, you know, make sure that you are also making note of what are the skills that they are achieving, no matter how small they are, and that you continue working on them, and that you know, like, when we've achieved this thing, what's the next thing now to look forward to, right? And also try to or don't try to compare your children to the other kids their age. When it comes to school readiness, like 5-year-olds, there's a pretty big range of what those 5-year-olds could do, right? Some of them are reading independently. Some of them are like, especially some of the girls, they're just like, they take off with stuff. And then you'll see like some other kids that are a little slower. It doesn't mean that they're not going to get there. And it's okay for them to be in a classroom with other children that are more advanced or delayed. They learn from each other. That's a really important, you know, I don't think that parents understand that sometimes. Like sometimes we're like, oh no, but you know, my kid is not ready. It's good for them to see the other child, you know, who can maybe teach them, or that might be a motivator for them too, right? So it's good for them to be in a classroom with different kids who can do different things. But we want to make sure that we have some good foundational things, and those are the things that you could be working with your children at home. So, you know, keep working on them, make it fun, don't be militant about it, and, you know, allow them to also like take the reins. Like, what are the things that they're like really strong at, right? So it's important for you to notice the strengths and the weaknesses, right? I think, you know, it's always good to be aware of those things, because then you want to also notice if there's any regressions in any area. And you want to also know how to keep supporting your child throughout that. Next slide. All right, so the role of parents in school readiness. It's really, everything that you do at home is so important, right? You are the first teacher. That's the truth, right? Like, you are the first teacher, whether you like teaching or not. I think it comes pretty natural for parents to want to teach their children though. And so make it fun, make it part of their play. That's another thing. Like, children learn through play. And so you want to make sure that when you're engaging with them, that you're making it really, really fun, because you don't want them to feel like they're in a classroom. You want them to feel like they're engaging with you and that they're having fun doing it. And I think that that's the best time for them to learn, and probably you'll notice the best growth happening during that time. So engage in daily learning activities. Encourage social interactions. This doesn't mean that you need to be at like every family event every weekend. But you know, choose ones that are important for your child, the ones that they are interested the most, you know, because I think my son and I have really different interests. I'm a person who is more reserved. Like, if it was up to me, my kid would be playing like violin and you know, piano and all of that stuff, because I'm just a very quiet, well, I have two personalities, but I'm a very like quiet person, where I don't like any noise in the house. My son plays the drums. So, you know, that was a biggie. I was like, you sure you want the drums? How about, you know, violin and, you know, piano? And he was like, no, I don't want those. I want the drums. I was like, all right. And it's funny because my brother also plays percussion, and I was like, oh my God, I remember all those years of him. My brother plays timbales. So it was like my brother with all that noise. Luckily now there are so many other things that they can do to muffle the sounds. I bought him an electric drum set. He was like, I don't feel the vibrations, so I don't like it. So I spent so much money on this electrical drum set, which we still have and don't use, because that feeling for him is important, right? So I didn't realize that because I'm not a drummer. I just thought that I was giving him what he needed in the home and also making myself a little happy, but no, that didn't work out. So choose things that are you know, that your kid is really interested in, not that you are necessarily interested in. Yes, you want to expose them to everything. I exposed my son into everything, baseball, karate, like I was like, you have to give it at least one, one term or one course or whatever, and then you decide if you want to continue. I never stressed anything to him. I want to just expose him to everything, right? Whether he thinks he's gonna like it or not. And expose your children to everything. See what are the things that they gravitate to, right? And then when you see them gravitating towards something, because those are other children that may have the same interests as them, right? Those are good opportunities for them to be social with other peers, right? Because it may not necessarily be the kids that they go to school with. But if you notice that they love, whatever it is, when he was really young, we used to go to Gymboree a lot and stuff like that. He loved those things because it's a lot of just movement of the body. It's really great for their gross motor skills, right? It was a place where I could meet other moms. It was a place where he could interact with other kids. So just, see what are the things that your child really loves to do, and that may be the areas where you focus more for social interactions. Establish a consistent routine. That for me is very important as an individual. For my son, I think is so important for him because he lives in two households. And we are two very different parenting styles. I'm very routine, and his dad is not. And when he's with his dad, he's always like, I don't know what to do. I'm very confused. When he's over here, he's like, this works better for me. So having a consistent routine where your child knows what's coming up next is predictable for them. You're going to notice like less of those meltdowns happening, more of like, okay, they can go with the flow. Of course, not everything can be a good routine all the time. Sometimes you have to tell your child, okay, I know normally we would be going to the park at this time. Today it's raining. We can't go. You show them that it's raining. Today is not the right time, but we're going to do this instead. Give them a heads up, because even if they're 2 or 3, they still want to be included in the plans, and they want to have, or they want to feel like they have this this ability to be able to just voice what they want, right? And so you want them to have some agency in their bodies and in the things that they choose. Like, just allow them to be a part of the plan making, even at that age. I think that's really important for their independence as well. Read books and practice communication. Have real conversations with your child, even if they don't speak to you. I would love for you to always continue speaking with them. Don't give up on this part. They need to hear the words. They, will learn how to like follow commands and everything, but you need to keep them a part of the speech and the verbal communication. I don't want you to give up on that. Always read books. Books are really engaging. Find fun ones that they love. Again, like if they have a certain special interest. For my son, it was Sesame Street for a really long life. Everything was Sesame Street in my house. Everything was Thomas in my house. Like, we went through different phases of different things. Those are the things that you can gravitate towards, and that they'll be more interested in and engaged, and you'll get a lot more out of it when it's something that they're interested in. So whether or not you prefer that, forget that. It's not about you, it's about your kid. And then advocate for early intervention when needed. Advocate all the time for your child wherever they are, because in every space that you go to, you will probably have to be your child's voice, and I am a pretty introverted person, so learning how to speak up was very hard for me. That felt really cringy for me. Like, I just didn't know how to speak up to certain people or how to say something, ask for things. That was really hard because I am also a very like independent person. I just make things happen myself. I don't ask, I just make it happen. And so that was a really hard thing for me to learn. And I think I still struggle with it, but we have to just learn how to advocate for our children unapologetically wherever we are. Sometimes that's in church, even wherever you have to learn how to do this because you are truly your child's voice. So don't feel ashamed. Next slide. All right, so collaborations are really important, right? When we have good collaborations, this is when your child will get the best out of everyone. I promise you this. And this feels like a full-time job sometimes because unfortunately, you know, educators work in silos, medical professionals work in silos, and then you're busy, right? If you're like me, you have a full-time job. I have two. And then on top of that, you know, I'm a single parent, and then, you know, I love to do all the things that I love to do. So having these open communication avenues with everyone all the time can feel like another job. And it is. It really truly is. Like, I wish we got paid for this because we spend so much brain power on this and so much of our time making all of these, you know, emails that we need to write, and then following up with them, and then connecting, you know, with the right people, asking the right questions, getting the right data. You know, all of this stuff is so important. So you want to make sure that you have regular communication between the educators, between the healthcare professionals, whoever is providing any support, any services for your child. You need to like constantly be the one who is like collecting the data and where we are now and what is the next goal and how are we going to get there and who do we need in order to make that happen, right? And so this is an area where I feel so many of us get very frustrated because if you're not getting the right communication from maybe the people that you're reaching out to, that can feel really difficult. And you know, unfortunately, healthcare providers are not the easiest people to get in touch with. You know, sometimes even when I'm calling another doctor, it takes forever for them to get back to me. Sometimes I have to make 2, 3, 4, 5 phone calls to speak with another doctor. And this is doctor to doctor. Like, this shouldn't be this hard. But, you know, there's a lot of those, what are they called? Phone trees or whatever. Like, you know, you leave messages. There's all these voicemails, operators, whatever. Nobody picks up the phone anymore. And, you know, I sometimes think that email might be the best way to communicate with people because it's already documented. And like, you could be like, I sent you this email at this time and no one replied. You know, you have receipts. You have receipts when it's email. So sometimes I do prefer email versus just trying to call because you will spend sometimes hours. Like, I've been on hold forever with some of these people. Okay. So I would encourage you to get a good email that you can communicate with people. And then, you know, maybe set up a time to talk in that way versus just being on the phone and being on hold and waiting for someone to give you a call back. It just doesn't work out so well most of the time. Sometimes it does. Sometimes you have a good, reliable office. But if you already know, like, you're going through a hospital system or something like that, get a good email. Get a good email. It's just better. You're gonna save a lot more time. And then you want to make sure that you have a good file of all the assessments, evaluations, consults. Have a folder for all your child's workup done between school and whoever it is that they go for their healthcare, their services, their therapies, everything in one place, because I guarantee someone's going to want to look for or ask you for a document. And if you don't have it that day, again, you might be at a doctor's visit and they're like, oh, you don't have the IEP with you. Now you just lost another opportunity, you know, or because you'll say like, I'll email it to you. They won't look at it. You know, just have everything with you all the time. It's the best way to do it. Have a hard copy. I think it's important. You know, like, yes, I know we're in this day and age where we have everything. Yes, keep another copy in your email, open up a folder there, have everything in there, but always bring a hard copy because sometimes things don't open. Sometimes systems are different. You know, whatever the case may be. And you want to have this shared goal setting for your child's progress, right? Always have these communications of like, what goal are we in now? How are we getting there? How long should this take, right? What do I do if there's any regressions? That's a big one. I think parents, sometimes they get really scared when they see a regression. And then they're like, oh my goodness, what's happening now? And they forget to communicate that with the people that may be helping their child, and then nobody's aware of it except you. So if you notice any of these things, you say it when it's happening. Don't wait. Okay. So data collection and tracking, I cannot emphasize enough how important this is. You will become the best at this. I promise you. You have to become the best at this because your child relies on you for this, okay? So make sure that you have all the receipts all the time. And then advocacy for resources and accommodations. If you feel like it's hard for you, because it is, get the help that you need. Don't hesitate. Do not waste time. Get the advocate. They're going to do the most phenomenal things for your child, and you're going to be so much happier and so relieved when you have that person by your side, because guess who needs support and who's not getting it? It's you. You need support because we're so focused on getting support for our kids that we forget about getting support for ourselves so that we can help our kids. Next slide. So benefits of collaboration are early identification of developmental concerns, right? We're not wasting time. We have more personalized interventions because we can literally say, like, this is where we're having some weaknesses. How do we make this better, right? Versus like having this like general sort of thing that they work on. You want it to really be customized for your child, right? And your child's needs. You want increased parental confidence in advocacy because this is a skill that you're learning too. You've never done this before, right? So you need to learn how to do this. We need better academic and social outcomes for children. That's the whole reason why we're doing this. This is why we're like so like stressing this so much about why you need the tools that are out there, because we want to make sure that we give our kid every chance to succeed. And we want stronger community support for families, right? So this is why we all do the work that we do. Like Paige, Kate, and I are doing this because we know how hard it is and we know that you need the support. So we want to tell you we're here for you. Like, we love doing this work. And you need the help. You do need the help. All right, so conclusion and next steps. Early intervention is key, right, to lifelong success. Get it started as soon as possible. Do not waste time. Just don't waste the time. You can never get the time back. So please take advantage of it. You want your child to be ready for school, right? You want to have this team approach. You want to know what to expect also, right? So this is why this is all important too. Parents, educators, and healthcare providers have to work together, and you are the liaison to make that happen. It's not going to happen. Believe me, they're not going to do it. You have to be the one who gets everybody in the same ball court. Like, that's just the way it goes. And then you want to advocate for better services and policies for your child all the time. And let's just build a supportive system for our children. That is, the goal that we all have in common. I have this beautiful resource over here. It's called the Tiny Mighty Autism Parent Planner. I love it because it comes with a video library, where I teach you how to advocate for your child. It has some really unique pages to it. I think you can probably just go through these slides. So you basically like scan the QR code and you're gonna see a video library that comes along with the planner, and it teaches you everything that you need to know about like tracking data and how to speak with the medical professionals and how to speak to the educators and how to keep track of all of this stuff. This is like my favorite page right here, the intervention toolbox, because if you leave your child with a new caregiver or they're entering into a new classroom, you can like tell the teacher right here in one page, like, this is the trigger, this is what we do, this is the plan and the strategy that we usually use. You can go to the next page. I think, there's the goal tracker here for all of the milestones. And I love this page too, because you get to just like have a place where you monthly do a check-in. It's a monthly check-in that you'll be like, okay, these were the goals. Are we still there? Do we need something else? Did we complete this one? Did we attain this goal? What were the achievements? What were the things that we could still consider a weakness that we need to work on. The therapy notes, I kind of like designed them to look like the notes that we use in the doctor's office. So the therapy notes and the medical notes both look similar, where you're taking some homework home for yourself as a parent that you need to continue working on, because you're the one that spends the most time with your child. So sometimes, you know, I not sometimes, every time. I don't like when I see parents on the phone during the therapy visits, because I'm like, you're missing out. This is your opportunity. You can learn stuff here that you can continue at home. So put the phone away and get engaged in the session, so that you can help your child at home using those same kind of methods that the therapists are using. And this is my son, Aaron. This is an old picture. Now he's 12, but that's one of my favorite pictures of him. He's doing so great. And I want to say thank you to both Paige and Kate, because they did help me with the whole auditory processing disorder. He's doing much better. I want to give you ladies an update. He is doing so much better, and he's loving his new school. And I'm just really proud of him. He made honor roll. It was a huge achievement. He was so proud of himself. As a mom, of course, I'm like in tears, because I'm like, oh my goodness, this was so important for him, for his confidence. He's a really great kid, and I'm happy that he could notice the academic achievements too, because he works hard for them. He really does work hard for them. I think there's maybe another one or two slides, right? I think one is just, this is my website. I think this might be a video. Maybe it's not playing. But in my website, we do have a podcast. We have a blog. I really focus on parents with kids with autism. This is Autism Awareness Month, so I've been really busy this month doing all of these sort of talks and everything. But my work is really supporting parents in every way, whether you have an autism diagnosis or not. I just love supporting parents, because I know how much we love our kiddos, and how, we want them to succeed, and we just want them to feel happy and live good lives. And, I really love what I do, and thank you for giving me this opportunity to be here today. If you have any questions, this is your opportunity to ask them.
Well, Dr. Divina, thank you so much. And I'm so happy that Aaron's doing well. That's great to hear. I really love that page in the planner for the therapy notes. I think that's so helpful, because I remember when my son was getting early intervention, and I mean, yeah, when you're engaging and you're in it, they're giving you so much information, and they're like, and you can try this, and you can try this. And I would jot it down in my notes, and then where were the notes on the phone, or I'd write it down somewhere. So that's wonderful. And it's great to, you can put all the questions you have and what their plan is. So I think that's fantastic, because when you have a child with a disability, there are, Tim, so you're getting a lot of different therapies, and
they're getting so many different therapies, and sometimes we don't know what to focus on. Or like I said, I see a lot of parents who are really like disengaged during the sessions, and they're just in their phone, and I'm like, you're missing all the important stuff. And a lot of these therapies are just half an hour. So, even if you take 15 minutes, do something, but like just be engaged, so you could see and continue those same exact things at home, and you'll notice so much more growth for your child.
And you have if I'm correct, you have a podcast as well, right?
I have a podcast. I have a podcast, and actually, my son just got on it. He's been doing a few episodes with me, and I think they're the best episodes, because you're just hearing it directly from him. Like I'm interviewing him. I didn't even like practice him or anything. I was like, hey, you want to do this? And he was like, yeah, I think other kids need to know. And I'm like, yeah. And he's very articulate, and people are like, I'm so surprised with it. And I'm like, yeah, he is so great at just like giving you what his experience is like. And then I did another season where I just interviewed autism families, everywhere from the younger ones to adults. It's mostly adults, actually. And that was really interesting. Like you get to see what the journey looks like, whether you're severe or more high functioning. Like it was just, it's so good. It's so good because you just hear it directly from the families. Like even interviewed dads and siblings, not just moms, like everybody. And I loved it. And then like my early stuff on the podcast is really just for new parents, where I coach them to help them during those like early months. I want to say like the first year of parenting.
And what is it? Can you share the name of the podcast just one more time, just so that people, if they're searching it?
It's called Dancing into Parenthood.
Okay.
Love it. Divina, have you ever heard of Welcome to Holland? I posted it recently on our Instagram. Have you ever heard of it? It's all about, I mean, it can be relatable to all different disabilities, but it's about you're a parent first time and you're expecting your child to your child's life to look a specific way just based on the norm.
Yeah.
And when your child's born and they start not reaching certain milestones, it talks all about, I mean, it's a beautiful poem, and I probably will like get emotional even talking about it right now, but it's about how you recognize that your child is, you're supposed to be going to Italy, I think it is, and then you realize when you get off the airplane that you're actually in Holland. And if you think all about how much you're missing from your trip to Italy, you're going to really like miss what beautiful aspects of Holland really is. So it's awesome. It's something
she said that to me. She said that to me the other day.
I like cry whenever I see it. It's beautiful. It's all about and being real and identifying like what your child, somebody once described their child to me as who has autism. My child has different superpowers that are very different. I'm like, that is such an amazing analogy because everybody has their strengths. So I have two different children that neither one of them have a disability, but man, they have their different superpowers, and everybody has their own strengths and weaknesses. And it's so important to recognize that.
It's so important. And, I think for me personally, I was always we call it in Spanish, like corre, corre, you're running everywhere. You're so rushed and everything. And my son really got me to slow down and see what's really beautiful about life, because I was always just so goal oriented. It was like next goal, next goal, next goal. I never celebrated anything. I was like that, nah. And my son is like slow and let's appreciate what's happening right here. And I never knew how to do that. And that's really a big gift that he has given me. He's really changed so many like perspectives in my lives, and my priorities are all different now. And my entire career has changed because of him. Like I really prioritize being a mom. And I never even wanted to be a mom. That's the craziest thing. I never wanted to be a mom. And I always tell him, like, you are the best present I never knew I wanted. And I think all of our kids do that, no matter who they are or what they may or may not be diagnosed with. I think that's the beautiful thing about being a parent. So I what I'm appreciating about this whole thing about the Holland thing, that now I'm gonna have to check it out, whatever it is.
Bring tissues.
This is a very emotional journey, right? All the time. But I think it's that, like, when I look back now, we're at 12 years old. And when I look back at those 2, 3-year-old, 4-year-old years, I hated them at the time, living them, right? Because I was like, it's so hard. Everything feels so hard. And now when I look back on them, I'm like, oh, I missed so many opportunities to appreciate the time that I was in with him. I was really busy working during that time, and I went through a really messy divorce and everything. And so I think I was so caught up in all of that the meltdowns and everything just felt so much heavier than they probably really were. And I think we don't notice it until it's kind of like too late. A lot of that, I hear that from a lot of moms, like, oh man, I really didn't appreciate those years. And the time really goes by so fast. And everybody tells us that, but we don't feel it when you're living it. But after, that time has passed and you're like, I can't believe he's going to be a teenager. I'm like, what the heck? it just flies by, and we missed a whole chunk of stuff going on, you know? So yeah, I have to, I definitely want to check this out, because I know I'm kind of in that space right now where I'm like, wow, I missed a lot of things. But
I'm just stopping the share really quick, just I'm gonna set up for Michael Sanzaro's. But Dr. Divina, this was so wonderful, so helpful. I think every parent felt validated hearing this, of just coming from a pediatrician, knowing like your concerns are valid. You have the right to express your concerns, and giving us.
You are your child's liaison. You're the liaison between all. I think that is like the biggest thing to take away from this, is that you're in control of managing everybody together. So thank you for that. That was awesome.
Yeah.
You're welcome. You're welcome. Yeah, no, thank you so much. And I wish you a lot of success with this. And also, you know, I just really want to send a lot of love and light to all the parents, because I know it's hard. I see you, I feel you, and you know, I share a lot of stuff on Instagram every day. Well, I've slowed down a little bit. I haven't been on social media so much, but I have a lot of good stuff just to support you, you know, because we need a lot of support ourselves.
That's right. Thank you so much.
Wonderful.
Thank you. Enjoy your day, ladies.
Thank you. And we will be sharing also in our follow-up email all of the resources from all of our presenters, so that everyone, if you missed something, we will send out their links to everything we have available. So the Tiny But Mighty Autism Planner, the podcast, all the things. So check out for that email later on today, guys.
Excellent. Bye, ladies. Enjoy.
Take care.
Thank you.
Bye.
Okay.
Hi, Michael.
Sorry, I'm going to unmute you. Hold on. There we go. Okay. Or I'm asking. There we go. Would you like me to share your PowerPoint, or would you like to share it? I have it up now.
No, can you guys hear me?
Yes, I can hear you. We can see you.
I was hoping for Dr. Divina to not get off, because I was going to put my first official complaint in, because I was so enthralled with her presentation, and I'm like, I'm not too sure how the draw fell, but I mean, for me to have to go after a doctor, someone who has a podcast, someone who's vibrant and can speak for an hour, I feel a little bit slighted. So, because I'm not going to, I mean, I'm only have slated 2.5 hours. I'll make sure I'll try to get everybody off within 2.
Yeah. We have you down for 5, actually. No, I'm just kidding.
Actually, you're actually the full day. So we must have missed that one.
Yeah.
I am certainly not going to speak an hour and 3 minutes, but wow, that was
That's
great.
all right. That's all right. When we can take we put ourselves on mute before, but we can even go back and forth if you want to. But everyone, please welcome Michael Sanzaro. He is a transition coordinator for Fairfield Public Schools, my district, which is amazing. He leads the 18 to 22-year-old community partnership program, which helps young adults gain real-world experiences. And I can see our friend Ray is on this call, so I think he might be really interested in hearing this. He's our presenter for tomorrow, but they would be great to connect with each other. Our district is really lucky to have someone with Michael's determination and heart leading the way to the transition program. I found Michael through a public speaking event that he was doing in our town. And I was like, you know what, who better than somebody that is doing it every single day and just a guru at what he does. So without further ado, welcome, Michael.
Excellent. Hi, welcome everybody. And I think everybody can see me. And I don't usually do these on Saturday. So I'm like, where am I going to do this presentation? But I'm like, nothing better than here in my dining room. So it is what it is. And I'm so excited to be here. And so, yeah, I'll elaborate on that a little bit. And I see you guys can see the presentation. So it's going to be kind of nice to be able to speak and not have to click at the same time. And so this is great. So yes, I am the transition coordinator for Fairfield Public Schools. I know that sounds like a big title. Like, what does that mean? And honestly, Kate just did a fantastic job kind of describing it. But just to give you just a little bit more background, so I actually was in the business world prior to getting into education for a little bit. You know, got out of college, was in the business world, and I was like, man, this sucks. I don't want to interview people all day long. And this is a little bit boring, and I feel like I want to do something more. So realize that my school counselor didn't really feel like they were so helpful to me. I'm like, what can I do that's helpful? So I went back to school, got a lengthy master's degree. How much time they make us all do to get into education. So it's well worth it once you're done. But once you're going in, you look at this plethora of education that you have to do to get into education. So I got a master's degree, and I was a school counselor for 15 years. Your classic guidance counselor, but the titles are school counselor. And did that from a variety of settings, from in-city to suburban to urban, helped to run districts, all different kinds of school counseling from college bound. Through that process, I didn't know what I was doing then would actually help springboard me into the future. Administrators having in some capacity when it came to special education, 10 years ago, they were just throwing at anybody like, hey, Mike, do you want to be a 504 coordinator? I was like, I don't know what you're talking about. I don't know what that stands for. Do you want to get involved with, IDEA? And I just said yes, and having no idea what it was. And so then I started running for Hartford and district, over 74 504 meetings. It became kind of an obsession, having to organize it and realizing how important this was. And then kind of realizing after multiple years of doing that was a really great skill to have, because not too many school counselors would have something like that. That then, fast forward, kind of springboard me to get into special education after COVID, and then hence becoming a transition coordinator. And some parts of my life and career, I didn't exactly know what the titles meant. And that's not like a deficit. It's just like education. They have these titles, and then you realize the job that you have sometimes isn't completely what that job is. So transition is really, for one time in my life, transition coordinator is exactly what it is. So I really do help transition students from, sixth grade into the middle school, eighth grade into high school, because those are two plateau years that are very important. And then a big part of my job is helping to make sure students transition from high school, if they have an IEP or 504, and then help them take a look at those pathways. So what's their next journey going to be? Is it going to be a traditional pathway where a student's going to go off, go to a 2 or 4 year college? Are they going to go to the military? What does that look like? And I help the team kind of look at those journeys. Or as a student, have a little bit more challenges. Do they have troubles with transition? And the state now is really refining that in terms of what those pieces are. Are there issues with post-secondary? Are there issues with independence? Are there issues with vocation? Daily living. So those components, I help those students. And many times those students have a diagnosis or primary disability of autism, intellectually disabled, multiple disabilities. And then I help them and their families. And part of my talk today, because I really wasn't sure who was going to be on today, but just thought, where can I be a help, is to educate people on information that I've become an expert on and help them transition into that world of 18 to 22. And many people usually have no idea that school systems have to educate students until the age of 22. So I think it's important to enlighten individuals on that. And then especially making sure everyone has information on all of the components. Again, not many people know that if you have a disability, you can apply for Social Security, Husky, and all those components. So I help families with all those pieces. So that's one of my jobs. The other job is I'm actually the team leader for the Community Partnership Program at Fairfield Public Schools, which is specifically the 18 to 22 program. And the Community Partnership Program really defines it. We're in the community. So I help emulate an environment for them where we're on a college campus at the University of Bridgeport. They're allowed to take college classes. I then make sure that they have a job in the community. And then we emulate that environment and then work on all of the deficits and skills that they need. And looking at that 2 years ago, I realized students with high functioning autism need something different. They need a different pathway because they have the capacity and the capability to be college bound. So then I also created a program at another university called College Connections, which is specifically designated for students that have autism with a midline IQ. So those are the pieces that I do. And that's a lot of what I'll be talking about today, specifically trying to educate everybody on some of those components. So that's kind of a breakdown for who I am, what I do, where I came from, and that's it. So I can always kind of think about these presentations. I try to make them as interesting as I can. I promise you that I'm just kind of going to be talking from maybe like the top of my head or from my experiences, but I do have an outline. So hopefully by the end of today, learning outcomes, we're going to have a greater understanding of what some transition resources are. I think that's important for everyone to have an understanding of what's available. And if some of this is repetitive information or information you already know of, I'll try to put a little bit different twist on it. Another learning outcome is understanding transition goals, such as supports and developing the IEPs. Most people and parents and even advocates, to be frank, sometimes go to PPTs and there isn't enough emphasis on something called PSOGs, which is the post-secondary outcome goals, which are very important. And then today we're also going to just talk a little bit about state agencies, options for students and disabilities, and some of those particular components that go with that as well. So I'm hoping to achieve these three areas in the next 45 minutes or so. And again, what's the outline? Are the questions come at the end in terms of, or people can ask questions kind of through?
Or if somebody, if something comes up and I can see it in the chat, we can pause you and ask then too. But yeah, put on it at the end.
Okay, perfect. All right, next slide. All right. Again, this is just a picture. You can move forward. Sorry, forgot my own presentation. So transition services. So most people kind of are in kind of two boats. And special education to me kind of comes in, as I think about it in just my experience of 20 years, special education from the student and parent usually comes from a mindset of when individuals have to worry about it. So, and what I think is helping, especially with transition law, is kind of putting a time frame on it. So, of course, if you're a parent and you can understand, how difficult this must be, but if you're, in early child education and your child might be, 3, 4, 5 years old, typically is when they come around the realm of being tested and some aspects of entering the special education world. Sometimes that's later in life. Honestly, I've actually just went through 3 PPTs where an individual was just recently developed an IEP in 10th grade. I'm not too sure why that occurs, and it does happen because I feel like that should be caught later in life. I mean, earlier in life, but it does happen. So I think in special education, especially in terms of accommodations aspects, it usually comes into an importance when it's relevant and it's important to the family. What I like about how transition services and law is changing is the accountability in some capacity is now making it a collaborative effort where there's now a time frame on it. So transition now, if you weren't aware, has to start when the child is 14 years old. So basically what happens is, and that's typically, depending on the age, at 7th, 8th grade-ish, and it starts with a process of really that the special education teacher and the team has to start thinking about, okay, transition, where it used to be an IEP is written, and there were some goals and there were accommodations, and transition was just a part of it. What's occurring now is that the transition services in Paige is really springboarding the entire IEP. So that starts at the age of 14. And, I don't know if there's any parents on here, everyone on here is educators or professionals, but again, I'll just speak globally. With that age now being 14, there's becoming a higher emphasis on obviously everyone who's a special education teacher, everyone who has a caseload, and the average statistic in general is it's anywhere from 13 to 18% of the population of all school districts. I give you a range; it's around there. In that range of that percentage of being the population of all students in each school district. So it is kind of high. So now to have that emphasis of it being 14 years of age, as educators, we now know when that clock starts ticking, there's specific things that needs to be achieved. So one, the IEP has to be looked at differently. The PPT itself has to be an annual review, a planning triennial, a review revise. But the secondary part of that is that the PPT notice has to say that it's a transition meeting. So my hope in just explaining this to you is that there's really 3 components. So there are 5 transition components. If you were to take a look at the state website, so I don't want you to be like, hey, what was that guy saying? He doesn't know what he's talking about. There are 5 pieces, but the 3 major components are post-secondary education, employment, and independent living. So as students start going through 8th grade, 9th grade, 10th, 11th through 12th, and start becoming young adults, those are the 3 component areas that the state looks at. So primarily, just to really break it down quickly, post-secondary basically means, does the individual and does that goal have the capacity to plan for the student for post-secondary? So post-secondary meaning after secondary school, high school, and then post. So what does it look like after? So we're looking at a goal always at the end. So if you think about an alphabet, sorry, I can't talk. The goal should be the Z, and what are the steps to get there? So that's typically what post-education is. Employment is basically, what is the student looking to achieve? So are they looking to achieve an occupation of interest? Is it specific? Is it engineering? Is it they want to get into the medical world? Is it a 2-year? Is it a 4-year college? Is it supportive? Is it independent? What type of supports does the person need? And then the last part of that is independent living. So where is the student going to live? So in the PPT, if you're a parent and an educator, you should be asking the student, and I highly advise, even if it's for part of the PPT, even if you have the PPT and then bring the student at midline in and talk some more for the hour, it's usually an average length of a PPT, or you start with a student for 15 or 20 minutes, the special education teacher should be speaking with the student prior to that meeting and asking some of these 3 questions. So, hey, Johnny, or hey, Cindy, after high school, what are some of the thoughts that you're thinking about after school? And then there should have been some non-informal assessments, maybe a personality inventory, a career interest inventory that could have driven some of those questions, and then again, hey, Johnny, hey, Cindy, what are some of the areas you think that you want to work in? Well, hey, my mom is a nurse. I think that's interesting to me. We talk all the time. Okay, great. So that there's some fine pointing of that. And in independent living, hey, Johnny or Cindy, where do you see yourself living? Do you want to live in Connecticut? Do you want to live in the South? Do you want to live where it's warm, it's cold? Do you want to live alone, independently, have your own apartment, have a house? All those should be questions that are kind of helping to get the student to be whole. And those 3 components kind of drive the IEP. So hopefully that makes sense in terms of how I define that. But again, the better you're educated on these 3 pieces, because if you're not, honestly, I've been to many PPTs, even with advocates, they're like, they want to get to the goals. Let's just talk about these 472 goals that somehow is never going to be achieved because there's way too many goals. And then the transition page is like 45 seconds. And it's something that really should be a major part of the conversation and should be driving the entire conversation. All right, so I did want to talk to you guys about transition assessments because, again, this is another piece that can be missed. So I'm just going to kind of give you guys a scenario. So let's say you're in a PPT and you're in a PPT with a young lady and her name is Elizabeth and she's 13 years old. And you ask her the question, which we all do, and I don't even know why. Hey, Elizabeth, what do you want to do when you grow up? How possibly is Elizabeth going to know that? And because all she's going to know is she's going to drive from what she does know. She's going to potentially know, maybe not, what her parents do, what her father does, her mother, her guardian, or whoever she's living with. And then think about that question even later. And what is mind-boggling to me is how much education has changed. We still don't spend enough time in helping to develop individuals for who they're going to be. And again, I'm not going to go into politically here, but it's kind of going back when I was in high school, and basically it was, college, school to career. I almost want to, I can't believe that was the title. And that what that really did was it kind of, evaporated any other aspect of who we are as an individual. But there's, I don't know how many billions of people now on the planet. I think it's 8 billion. But obviously we need all different kinds of individuals in terms of helping us get through our day. So helping to have assessments which are not informal and informal to work with Elizabeth to help her find who she's going to be. The other piece that I think is very important in this, and it's kind of something that education has also, I think, been part of that we need to start changing, is that many times the onus and the work completely relies on the educator. For it to be successful, the work has to be collaborative. So the parent has a part, aunts, uncles, nieces, nephews, to help Elizabeth to network. How are they going to know what they're going to want to do unless they make it realistic? They got to, speak to people around them. What are the things that they like to do? Talk to your child or to your cousin about, hey, this is what I do. Like I'm a medical assistant and I help, the doctor when the patient comes in. Other than that, it's just a title. So non-informal assessments and formal assessments are kind of part of the process. And I kind of go over is like what it is. So it's ongoing and it's cumulative. Where we make a mistake is that we give one assessment when the student is in eighth grade. And so that assessment could be a non-informal career interest inventory and personality interest inventory. Or we'll do a MAPS. And that's a lot of work. Those things are important, but just can't be done once because you tell an eighth grader, at 14 years old, hey, we did this personality inventory and we did this career interest inventory, and it says that you should really be an airline pilot. And then they go on a flight to Florida 2 years later and they hate turbulence, and that's all they remember is that their inventory said that they should be an airline pilot. It doesn't give them enough information to help them develop into the person that they're going to be. So it should be ongoing. It should be individualized. So if you're giving Cindy one type of personality inventory, and that drives some questions, it doesn't mean Johnny and the other 28 kids in your class or the other 1,500 kids in the high school is going to be sufficient. What I've also noticed is that not everyone in the high school, as an example, or in the eighth grade, gets an assessment. Only when there's a 504, a PPT, maybe the student's struggling. We've identified maybe the kid has, ADHD. There's some components coming on. Maybe is this kid autistic? Is there a diagnosis here? When there's more time, I know this will always then come down to like, how are educators going to do all this? That's why it needs to be collaborative. It's not just on them. It's a conversation. So non-informal assessments, conversations need to be, over a period of time. And again, what it is that it's ongoing. It's based on student strengths. What it's not just done once a year. It's not just done one time. It's not just done to be completed as part of a process for the IEP to suffice because an advocate asks for a transition assessment. It should be something that's part of the development so that you as a parent can learn about your child more. You can have open conversations. The educator could learn more or the administrator can learn more about the child. And it's something that could be a great springboard for conversation. All right, so I wanted to give you, I'm just going to take a drink because I didn't realize how long talking for 23 minutes could be. I'm usually a talker. And I was real worried about talking for an hour here, but I'm already 23 minutes in, so that's not too bad.
You got this, Michael. You got this.
Got it. Thank you. All right, so 2 assessments that I really, really recommend. So these are more formal, but prior to you get to this point, there should be some non-informal assessments. So non-informal versus formal. And all that really means is that, to me, is in terms of just during the evaluations and the process, is just, I'll make it simple for you. Non-informal are typically a little bit shorter and formal are longer. It's more in depth and takes a look at strands a little bit more than some of the non-informal. You should never go from doing nothing right to a formal assessment. There should be some steps, meaning that maybe in 7th and 8th grade, 6th grade maybe, there should have been some conversations. You met with your school counselor, your social worker, the teacher, a conversation. Lessons have been come through in regards to, college cruising, career choices, a general conversation. Some guest speakers have come in to talk about different aspects and not just your traditionals, doctor, lawyer, nurse, really kind of giving the gamut of what's out there. And then from there, the class could go through some non-informals, like I mentioned a little earlier, a personality inventory. Everybody should know what their personality type is. Everybody then from there should go on ONET, do some researching in terms of careers. This could be a great facet into math because, again, just talking about salaries, you can offset that and really break that down and put that into your math lesson. And then a career interest inventory, and then at least 2 or 3 of those components. These evaluations I love and are really at the forefront. So you have, as they get, let's say you have a student that needs a little bit more in terms of evaluations and processes and conversations. So the TPI stands for the Transition Planning Inventory. 3rd edition is the one you definitely should use. Do not use the 1st or 2nd edition. They're fine, but you might as well use the most relevant edition that's out there. It's a very inexpensive, the entire packet as a school district, I think it costed $735, and that's for the entire box, all the evaluations. And then usually what the hiccup is, oh, this is something else, training. If you read the manual and you do 1 or 2 of these, it's not that complicated. If you're familiar with the AFLs or the AFLs, depending on how people pronounce it, AFLs is very detailed, but this gives you a great idea in terms of some of those components going back to the transition pieces such as post-secondary and independence and daily living and vocation. This gives you a really good idea of those 3 areas. A more in-depth process is what's called a person-centered planning. The one that I recommend is the MAPS. You have to be trained. This isn't something where you kind of never kind of gone into it as an educator and say, hey, I'm going to do a MAP. You really should have a set team, somebody who's in charge of maps, and then usually there should be like 6 or 8 people. It should be a team of 2 in the district that knows how to do maps. If there's anybody on here in a district that hasn't become maps trained, I highly recommend this. Hartford, I can't think of who offers the training right now off the top of my head. I can get back to you on that. But it's definitely something that I recommend everyone doing. And maps kind of defines it. You really are making a map for the students. So there is a picture that many people, depending on how artistic they are, you can actually develop a map through the process of going through the MAPS process, because you're really looking at the student's strengths, weaknesses, what is the end goal, what's the nightmare, and you're really kind of going through that process to helping to develop a story. The best maps are ones that everyone's involved. So you should have the educator, the special education teacher. It usually takes 2 hours. The parents could come in, next door neighbors, nieces, uncles, nephews, grandparents, anyone who knows a child. I did a MAPS once and there was 35 people in the room. And that really helped to develop stories, and it really got people laughing and talking about a collaborative process. That was something that was really awesome. And then from that, some really great outcome goals were able to be achieved. And then, each person left the table, including the parents, in a collaboration of things that needed to be achieved over the next 2 years. So those are 2, highly recommend. I could not recommend these any higher in terms of when they're achieved. If I had to identify a good time frame, I would say a map should be done in the 8th or 9th grade year. And the TPI, perfect timing for that, I would think would be the best ones are typically tail end of the sophomore year or the fall of the junior year. And that gives a great time for development in terms of the students learn some things and develop through high school. And then there's maybe a year and a half left in their high school, so that there could be the gaps can be achieved by the time we have to talk about 18 and 22 programming if it's a necessity.
I mean, we're talking about special education, but like this makes sense for everybody, like talking about next steps. This is I know that it has to be specific to children with IEPs and 504s, but like this is something that I think everybody could benefit from, having a map of goals for yourself, especially at that age.
Yeah, absolutely. I mean, I'm trying to, maybe I'm not saying it strongly enough. What I am kind of subliminally suggesting is that these usually are only done with students that have 504s or IEPs, which, if you can think about it, if we look at general statistics, and it's a real statistic, 60% of students that go off to college, 60% of them don't return to that college. So and again, that's you break that statistic down, some of them hate college, some of them didn't like the living, they're going to turn into commuting students. So that statistic isn't, everyone leaves, but, college is really facing a staggering problem, in terms of how expensive they are. Why are freshmen leaving? Why is such a high percentage of freshmen failing out? And you can sit there and pinpoint that as many kids are going to college and they have no idea who they are, what they want to be, and what they want to achieve. And then you put on on average 2 to 3 hours of work per class on them, and 75 pages a night to read. When they just only had to read 20, and work was chunked and broken down and streamlined for them, it's almost a nightmare. Hence part of why I developed that college connections program through the other college.
Welcome.
So great point. Yeah, it's something that every eighth grader, ninth grader, 10th grader in some capacity should be looked at. And I know then the answer is, well, how possibly can we do that for 450 eighth graders? Like I said, it could be embedded into the math and English curriculum in 15 minutes over the summertime. It's very easy and achievable. So transition timeline and transition options, kind of going off of that. So that was perfect timing. I don't know if you pre-read my slide.
I did, but no, that wasn't planned.
So transition timeline, I gave you kind of some insights here. So, eighth grade, kind of breaking this down for you in case this is something that you've never kind of seen or thought about. Eighth grade, you definitely want to identify interests. Every eighth grader, I'm not talking about 504 students and only special education students. But again, of course, we want to focus and make sure that we're achieving it, because then it becomes legal if we're missing those pieces in eighth grade, ninth grade, and so forth. But again, every eighth grader, in my belief, you should really be looking at what are their interests, what are their learning styles. They should be looking at career exploration, self-advocacy. I like literally, if I could wipe out just and talk about how to teach somebody how to self-advocate. That in just one 45-minute lesson, to be able to communicate, like going up to your English teacher and talking about homework and the dog didn't eat it, joke. But being able to communicate about that, because we're so fixed now, everybody in their phones, that communication piece, how to advocate. What are self-advocation skills? Especially if you're a special education student. I haven't done one TPI wherever. I've done probably, I don't know, 400 TPIs in the last 5 years, give or take. I think I'm like on 405. I think I just got 5 more I have to do. Every single student, without a shadow of a doubt, has failed in self-advocacy. So that is a great area that we really need to focus on. Communication and social skills, I think, is something, and then really talking to them about graduation. Although that feels for an eighth grader that's 400 years away, talking about what graduation looks like, because it really is only 4 years away, and in the end, it's like 15 minutes. It's like, it goes away. So ninth grade, again, developing those interests, the aptitudes, you're really then starting to focus on goals, because now, if we look back at that timeline 3 slides ago, it now becomes legal. You're now thinking about every kid has to have 3 post-secondary outcome goals that you're going to have to live to. So, developing them, I can't even talk, developing them, and then thinking about what they're going to mean can mean a lot of work for you, or not a lot of work for you. So making sure you have good post-secondary outcome goals, one as a student and a parent looking at them, and 2 as an educator, that is critical, because you're going to have to live to it. 10th, you're now obviously reviewing those interests. You're creating more skills. You're adjusting a course of study. Is a foreign language necessary at this point? Is that something that's adding on too much stress? So looking at all these components, how can the schedule be developed? Because there's 2 more years. And then obviously junior year is important. Colleges are taking a look at this. Your junior year grades are highly important for colleges. And then as we get into the 12th grade year, you're thinking about completing graduation requirements, applying to colleges by October, November. I think the deadline now is December the 1st. Taking my school counselor cap off, I haven't had for a few years. I think that was the date. And then again, any trainings, pieces, we're starting to look at students that do need 18 to 22 programming. What does that look like? All right, so students that have 18 to 22 programming. This is really a conversation. Just had a case yesterday, and it really frustrated me. Meeting with a senior, and we started talking about 18 to 22 programming, and today's date is April the 5th, and yesterday was April the 4th. And it's the first time that it's ever been brought up. And so that's a problem, because this is something that should have been done a year ago. And it's something where, like, hey, if there was any concerns, a transition evaluation. The student is having some issues with, who they're identifying as. So all of these conversations now there's 2.5 months left of school, right? 2.5 months. And now all this has to be figured out. And then then we're like, okay, what's next for the student? So really developing a plan and making sure all of the pieces come together through the junior and senior year are very important. But basically 18 to 22, if I could kind of give it a Cliff Note version, you're really taking a look at what does off-campus employment look like. You want the student to be in the community. And every school now is going to need an 18 to 22 program. If no one is aware of that came down from the state. Everyone needs to have an 18 to 22 program. Thank God for Fairfield. We kind of really, again, I am giving ourselves a little bit of a pull. I think we do a great job. We try to knock it out of the park and what we do in terms of the programming. And it's not as hard as it sounds. It's just putting a program into place. So off-campus employment, you really want to focus on independent living because, again, as those students become 22, 23 years old, can they be in an apartment or a home, leave the stove on, be able to cook for themselves independently with no adult support? If you left them in a Panera Bread, can they figure out how to get into Uber or public transportation and get themselves back? And then all that type of stuff is wrapped into money management and all those pieces. You want to make sure you're having training. You want to make sure that they're working at least 20 hours a week. They have transportation skills, housing options. Now, when I mean housing options, I don't mean that they're living somewhere while they're in an 18 to 22 programming. What that means is if they're making $18 an hour at 32 hours a week, they don't get full-time benefits. Can they live off of that 18 hours? And then how are they able to find an apartment? Are they going to be in a group home? Are they going to live independently with one or two friends, depending on how disabled the individual is? So they need to really understand housing because we want to think past parents. Parents are at that point, going to be, having to think about what's going to be life for my child after I'm no longer here on this planet. So we want to make sure as educators and as a team that we are educating individuals to be able to have housing options. Leisure skills, if individuals don't have leisure skills other than being a PlayStation and texting, which is a deficit, they need to know where their local YMCA is, a gym, options, boys and girls club, things that they could do outside. And then obviously making sure that there's a summary of performance so that, you understand how the person did perform and have a summary of it through that 18 to 22 program. We can move on.
Can't hear you, Paige.
Now you can hear me. I was just answering someone's question in the chat. They wanted to know if your slides will be available after. So if it's okay, Michael, are we able to share your slides with?
This is highly confidential information. We're going to have now, of course.
Okay.
We're also videoing it for those that do not know.
Yes, it will be recorded and it's going to be shared with everyone who is registered. So if you got the link from a friend, just make sure to head to IE Practices and just register so it can get go straight in your inbox. But yes, we will share.
So I've kind of already been talking about this in several layers, but I kind of broke it down in this slide. I won't talk about this too much, and I don't really remember how many slides I have left. But knowing your child's IEP, and that I tried to think of a title, what I mean by that. And what I mean by that, honestly, is everyone. So if you have a child and you're the parent, you should really know your child's IEP. I cannot say to you, and again, no offense to any advocate, but if you're a parent and you really know your child's IEP, I don't think all the time you need an advocate. If you don't really know your child's IEP, then I understand the benefits of an advocate, why they come to meetings and the necessity of that to make sure the district is doing everything they need to do. But again, education is information, information is education, and it's also power. So going into a meeting and really knowing what the goals are, because a lot of times, like, well, we need more goals. We need more goals. Again, I'm not exaggerating. I have a student that has, I think, 103 goals between the goals and objectives. There is no way, I'm just being transparent, that those could be achieved. And then coming to the end of the year, well, why was goal 17A, 23B, and 42A, and objective 4, 5, 6, and 7? I'm like, what page is that on? How were those not achieved? Because there's too many goals. Because the faster it usually goes, the more goals you think there's going to be more output. I would say having less goals and being very specialized and specific to address realistic options each of the 4 years would be much more advantageous than just having a bunch of goals dropped onto an LC teacher, a CL teacher, or a special education teacher. So if you're a parent, really knowing the goal, knowing the IEP, if you're an educator, and again, I say this in all support, if you can imagine being a teacher with 28 to 32 kids in your class, where 6, 7 of them could have IEPs, and you're staring at 28 eyes of students, you have to remember that you have 28 kids. You could have 7 in your class that have IEPs. You could have 4 that have 504s. Just think about that. How possibly can you achieve any, realistically, like have that all memorized? So the more that you can meet as a team with the parent, talking it through, that's how you're going to know the IEP. You're never going to just sit there and read 27 pages and have it memorized. When you collaborate and you kind of know, okay, I've talked with Mrs. Johnson knows this is how we're teaching, this is how we're addressing it, then you just know you're collaborating through the IEP, and it doesn't become a battle. And then again, kind of talking about some of those pieces that I talked about earlier, PSOGs, or what they stand for is post-secondary outcome goals. If you have 3 really good post-secondary outcome goals, and I kind of gave some suggestions here. So the post-secondary is really kind of taking a variety of looks and shapes the 2 or 4-year college choices, and something written very specific for that. 2 is the employment, and this is generally a specific statement that reflects the direction of interest when it comes around employment. So they shouldn't be vague. It shouldn't be like, Johnny's going to get a job after he graduates. No, duh. What is the job going to look like? Is it specific? So the more specific it is, and I think Dr. Divina talked about SMART goals, if I remember correctly, or someone.
Come on, Michael.
Oh, Kate did.
We did.
Kate did. So sorry. I heard SMART goals.
SMART goals. Yeah.
And basically what that does is, if you kind of go down that ideology, it helps you write things that are really achievable. So the more that you can make it specialized and specific, the better. And then the last is independent living. Then really what that comes down to is the student going to live in a supportive environment, or, in a competitive environment? Are they going to live independently, individually, on their own? Again, the more specific these are, the better. All right, moving on. All right. Probably 85% of my job as state agencies. So again, I'm gonna talk about these. I don't know if this is something that everyone is aware of, but I can say without a shadow of a doubt, every day I'm surprised of how this information is not disseminated to all families. And I find this to be very passionate of me, and making sure that everyone knows about this. So anyone with a disability, and then I'm sometimes sitting there and the person is a junior and they have a primary disability of OHI or ADHD, and I say this to them, they're like, well, why would I do that? And it's like, well, because you don't know what the future is going to hold. Do you know for sure that when you turn 18, that you're going to go off to Mitchell College, become, a business person making $85,000 a year, hold full benefits, and drive, the car that you want, and then living in an apartment in downtown Fairfield? You know that all that's definitely going to come together for you? Is that going to be achieved? Like, you have a primary disability, you have an IEP. So making sure that individuals are aware and they understand what their primary disability is. So, sorry, talking. If somebody has a primary disability of intellectually disabled or autism, knowing the term DDS is going to be very important for you. So you can apply under the eligibility application for someone with an intellectually disabled, and apply and get full services when the individual turns 22. I won't talk into great depth in this, because that in itself is a 3-hour presentation and conversation and meeting. But just know that if you have a child or an individual who is identified with ID, DDS should be something you're talking with whoever's in your district, or somebody, or myself, to give you more information on that. If you have a child or an individual, and I can't tell you, I would say almost 80% of the individuals that have a primary diagnosis or secondary diagnosis for autism are not on the autism waiver. So knowing what the autism waiver is, because there's a 10-year wait list, and applying to that as soon as possible. So if that information can be given to a 6th or 7th grader when they have a disability of autism, By the time they're almost done with high school, that then can be coming into play. Whereas if you're a junior, then applying for the autism waiver at 17 years old, you're going to be 27, 28 years old before you can ever take advantage of it. So the sooner that that information can be shared is better. Social Security. So again, something that becomes a great confusion for families is, well, why would I apply for Social Security? Well, because you can. So if you have a primary disability, and if you want, this is something that's an option. The individual at 18 years old could apply for Social Security support under a disability and receive that support. Of course, if they then go on, get that job making $50,000, $60,000 a year, and everything comes to fruition, then it may or not be needed. But for many families, Social Security support is a lifeline, depending on the disability. Husky and Medicaid, obviously, students can get support and under the primary benefit holder of the parent until the age of 26. But again, making sure that a child or a young adult is educated at 18, that they can apply for Husky if they want to, can be secondary insurance. And then in addition to that, it can be their primary insurance after the parent and they age out at 26. BRS is an agency that if I could actually give them like a golden star and an award, I would, because they are absolutely amazing. BRS is the Bureau of Rehabilitation Services. This is an essential agency basically wrapped around vocation. So if a student has a 504 or an IEP and they can be competitively employed in the future, this is an agency that you definitely want to make sure that's in your tool pouch. Because once a referral is made, they have to assist you. And then if you're a junior, they have a summer-based work experience that really assist in regards to taking a look at, who the person is and can they actually, work independently. As an educator, you should be referring every student to the BRS summer work-based experience. And then beyond, after they're 18, there's the adult side and the adult agency. Guardianship versus conservatorship. This is something that everyone should be a little bit versed on. Unless you're an attorney, you shouldn't be guiding for what a person should do. But the information of guardianship and conservatorship should be provided to the parent so they could look into it at their local probate court. Because when a child turns 18, they're in charge of their own PPT and IEP process, and parents would then become secondary and not part of that decision making. So if a student does have multiple disabilities or intellectually disabled or even autism, you definitely want to take a look at those two components. And then without a shadow of a doubt, I cannot recommend, and this is not even if you have a child with a 504 and IEP, just having a child in general, in terms of your family, you want to take a look at speaking into an attorney, looking into a trust, and really supporting and protecting what you have in terms of your home and all those pieces as you help develop a plan for your child after you're gone. So I'll go in, I'm not going to go into great detail of this, but I'm going to talk about the ASD waiver because it's one of those things that for whatever reason just gets missed and it's not informed on and not educated on. And that was what I was talking about a few minutes ago, which is the autism waiver. The autism waiver is through the Department of Social Services. It kind of got broken off from DDS, but again, it's just the same window. Don't get confused with it. It's the same application whether you're applying for intellectually disabled or autism waiver. But again, it's the eligibility application. If anybody wanted this, I'm more than happy to get it over to Kate. I have it in a link and you can apply for this. And again, it's a 10-year wait list. But as soon as you get on the wait list, you are able to take advantage of any of their resources, and they have grant funding. I've given you 2 contact phone numbers in here. I think Nate Calixto is actually the primary resource specialist. I didn't have time to actually change this. I'm not positive, and Kathleen Calloway, but I know Nate for sure is part of this. So as soon as you're part of the process, you're able to take advantage of, weekend respite. There's summer camps, Camp Harkness, disability-related expenses. If you need in-home supports, BCBA. There's all kinds of things that you could take advantage. I think it's a $5,000 grant each family could actually take advantage of yearly, if I'm not mistaken. This is the next few slides are just kind of me standing on a soapbox and just me thinking about aspects and honestly really thinking about aspects of what there's a question. I don't know if we want to come back to that later.
Sure, I'll read it. Do they have to process the application and place a child on a wait list, or is it simply submitting the application enough to access the resources?
So if I understand the question, there's a 10-year wait list. There's not a 10-year wait list to do the application. So you want to do the application. If you have a child with autism or you're an educator and you have children with that have autism, you want to do the application yesterday, or yesterday meaning like ASAP, and get it in, and then they're going to be on and about a 10-year wait list. As soon as they're on that wait list, you can immediately, and you get the letter, you can immediately take advantage of the grant funding and all those respite services that I talked about. You can't get a full funding stream until after the 10-year wait list. But as soon as you're on the wait list, because sometimes like, whatever, 10 years, why even do it? No, you want to do it because you want to get on that, because that will help you with any supports. Let's say if you want to apply for Social Security, want to apply for Husky, any component that you can have on and have that kind of in your backpack is going to be a benefit to you. You do not want to wait on that autism waiver. I think I answered the question, but maybe I didn't. All right. So if you could imagine, and this is true, it's a real statistic. I didn't make this up and just said, yeah, 33.5. No, it's a real statistic. Only 25% of families who experience intellectually or developmental disabilities actually take advantage of services through DDS, Social Security, and Husky. It's a fact. And I don't know, I'm trying to determine really what it's coming down to. I think some aspects it comes down to education. It comes down to a mindset. And I think it all comes down to also the aspect is like, I don't know if I want my child to have Social Security. I think it's an internal thing, where I think these services are advantage to you. And I can't tell you when we sit down with individuals and we give them their Social Security check of $748 and we break it down, and then they have a monthly budget. We put that on a Visa credit card for them, and then they get money to spend when they go out on a community outing. It really makes them feel like a whole person, an independent person in their community. So I cannot express to you again, help me, help the team here today, help your educators, get the information out. If you can't fully, talk about it and feel versed and feel confident, I'm being frank with you. I'm not even looking at the slides. I'm kind of loosely looking at them. This is how I do on my presentations when I talk with families. I cannot stand not knowing something. If I do not know something, I'm going to know it so I can say that I'm expert on it. If I don't know it, I'm going to say, hey, you know what? I don't know, but I'm definitely going to get you an answer. But I think the more educated people can be, the better off it's going to be for them. And then the fear factor is pulled away, and then they can become an advocate for their child, and they can help the school system be more efficient and more effective. So yes, it's a true statistic. 25% or 3 out of 4 people with intellectually disabled are not getting the services that they really could be taken advantage of. Moving on. I wanted to kind of talk to you about a few post-secondary options, because again, another question that kind of comes up is, well, can my child really go, if they're intellectually disabled or if they have an IEP or 504? I don't know if college is really an option for them. So obviously the answer to that is yes. So I emulated an environment for them where they can audit classes on the campus of the University of Bridgeport. And I have an environment for students through myself in Fairfield at Southern Connecticut State University, where they're fully immersed and taking college credit with individuals that have autism. But a few options in your backyard is Norwalk Community College. They have actually, there's more than it's even here, but they do have college steps. They have, I think it's called TRIO, TRIO. Those are 2 programs within the school system, because now all the community colleges have kind of joined, but again, they still are separate, but they're joined. And those are some resources. I've given you a phone number, some contact name. But again, if you go on their website, you kind of break it down into student with disabilities, and they have all the resources. And then another one is Housatonic Community College, right in downtown Bridgeport. People say Bridgeport, like, oh wait, no, it's beautiful, beautiful campus. Go walk in that building, and it's as nice of a state building that you could think of. Marilyn Ware is the director of disability access support. She's a great person, making sure that the accommodations are there for students in regards to what's available for them. So these are great resources for you, for a student to just, go in and, try a class, see, whether they early college credit as a senior or graduating and moving on and taking their first class as a post high school student. This is somebody that I want to throw in here. His name is Andrew Arboa. He is an individual who I met, I think, 6 years ago. He used to have a driving school that used to want to educate people, especially if you had autism. But he's a young person himself who grew up with autism and now can become a self-advocate, a speaker, a mentor. He gives unique advice on any individuals that may need driving assistance. So I've given you I've given you a website. I've given you his email. So feel free to reach out to him. He's definitely somebody and a great resource for you. You can move on from this. See, I don't remember my last few slides here. I know I'm already at the hour, I think. This was just a picture.
Oh, okay. Okay.
In case I needed some fluff time to continue to talk, you can move on to the last slide, I think. Keep on going. All right. So some of the things that Fairfield's doing, just to kind of talk about it, and just a last piece. I don't know if there's anybody in here from the district, but obviously, like I mentioned, we have 25 students in our community partnership program that support individuals with multiple disabilities to high functioning autism to medical fragility. So that's what we do when we really try to support the student the best we can and individually, and that's on the campus of the University of Bridgeport. We offer peer mentoring, college classes, auditing, and then community engagement. And then, like I did mention to you last year, and this is our first conception, and next year is going to be year 2. So we really are offsetting that. And then it's called College Connections. We're working on making that option and then offer through other school districts for the year 26, 27. So this year is going to be our billing process. We're going to have 7 students, and then we're going to be contemplating offering it up to other school districts to offer this platform for individuals that have autism, specifically when you're functioning and have some concerns with executive functioning and all those pieces. So it's a full wraparound support system to help students become successful at the college level. So look forward to any questions you guys might have on that or any of our programs, but this is the 2 pieces that we offer as a school system that I'm in charge of through Fairfield. And I think that was my last slide.
That was awesome. Well, it's clear, you said before, like you were in a different job post-college, and it is clear that your journey has taken you to the right spot because you are so passionate and devoted to helping. I mean, we all are on this call, but I just think that you are just a plethora of knowledge. And
Someone had a question in the chat again, real quick. Christina wants to know, is College Connections part of Franklin Academy?
And they define what Franklin Academy is. Is that a school system, a school district? What is that? I mean, the answer initially is going to be no because it's part of Fairfield, but I don't know. I don't want to just say no and not understand the question.
Okay, Christina, do you mind sharing a little more info in the chat if you can? Just so that Michael can answer that question a little better.
And Michael, while we're waiting for Christina to write back, just thinking about, we talked recently on a webinar and we're talking tomorrow about executive functioning, and just having students make these decisions and how crucial the MAPS and the other one, I forgot the acronym from it was, but yeah, just how crucial it is. Like we're talking about brain development not really fully developing until like later into their 20s, and they have to make this crucial decision. I want to be a pilot at 14 years old and mapping out their future. I mean, I just think that I learned so much from this presentation. So
for sure. Well, again,
Christina said it's a private school in Connecticut.
All right, so let me explain this a little bit more clearly. So College Connections was a brainchild of mine that I wanted to bring to the forefront because I noticed that individuals with high functioning autism kind of get pigeonholed into an 18 to 22 program and then don't have the capacity or the ability of the supports to then go off to college, and then they typically aren't successful. And that is from the experts at the college level. So I spoke to some experts, one of foremost with Fred Volkner, who's one of the top forefront experts in the country, who happens to work at Southern Connecticut State University. And then we developed a program at the campus of Southern Connecticut State University for a collaboration with Fairfield and that college. We have then through this year realized that we have been massively successful because 2 of the 5 kids are then now moving off to, one's going to go to University of Florida that would have never been able to go to college, and one's going to an automotive program. We're keeping 3 for year 2, and then we're bringing in more students coming in from the high school. So it's kind of like a funneling system for kids that have autism, specifically for those kids, or any kids that struggle with some of those components of autism, like executive functioning, social skill development. So that is a program that we're offering, that we're going to be offering out to other school districts that can work through me to then have those students go into that program, kind of like an outplacement.
We have another question for you, Michael. Is there a certain level of autism that a person has to have to qualify for the autism waiver?
No. No, it's just they have to have a primary or secondary diagnosis.
Okay. And then I guess on the same thing, I think you had mentioned like there's typically the earlier the better to qualify to submit for the waiver. So there's no age either. I assume it's just kind of like if it was like first grader.
Yeah, as long as you know that you're in your child through either through the school system has diagnosed or through your medical provider, the quicker you could get on that autism waiver, the better, because then you think about that 10-year wait list, it's 10 years. So for whatever reason, I don't know why, most individuals find out when they're like sophomore or junior, it's like, I'm having a meeting, it's like, well, your child has autism? Like, oh, okay, well, you've been autism waiver? No, I never heard about that. So again, because we kind of just get caught up in our norms. So I'm trying to work very hard trying to get that information out to the elementary and middle schools. And again, that's no deficit to myself. I realize probably someone's thinking like, well, why is it? I've been in transition for 5 years. So, prior to that, I was a school counselor. So again, if I've been doing this for 30 years, everybody would know about it. But the quicker you can get it down to the earlier years and such, the better, because then that wait list evaporates by the time they're getting to their senior year. If you get it out quicker versus them waiting till they're 30 years old and applying when they're a junior or senior in high school, the better. So the quicker you can get that in, the best.
And then just interesting, Christina said that she had Googled college connections and that for some reason Franklin Academy came up. So that's why she was asking. So I don't know.
It might be I didn't patent the term. I just thought college connections was something that sounded kind of cool. There could be another academy that used the term college connections, but we use the term, the collaborations between Fairfield and Southern called college connections. It's just the way we titled it. Maybe I should patent that. That's it.
Yeah, to get the trademark in on it. Yeah.
Tomorrow we have Ray Gordon, who's on this call, who is a neurodiversity consultant trying to work with small businesses and large businesses really for people of neurodiversity to be employed. So this is really helpful. And then, he's saying hi. And then the next, and I think that maybe you guys should connect offline at some point, because I think this would be a great connection. And then you were speaking about, different trusts moving forward. And we have somebody from Northwestern Mutual speaking tomorrow on the ABLE Trust. So we're trying to cover early intervention all the way to life after. So
I read all your presenters and I made sure that my presentation really was a springboard for all your ones moving forward.
Thank you.
I was really trying to be concerned for you guys.
Thank you. Well, Michael, we really appreciate you taking the time on this dreary Saturday to present and just to educate all of us. I found it very informative, and we feel like we have a plethora of knowledge ourselves, but we just learned so much. So thank you very much.
You're welcome. Everyone have a great day, and I really appreciate the invite, and hopefully the information was usable, at least some percentage of it, somebody learned something. So that's all I was hoping for.
Yeah, it was fantastic. And then just once again, just going to reiterate that we will be sharing the slides from our presenters. We're going to be sharing the recording in case people hopped on kind of midway through or weren't able to make it today. So we're going to be sending a plethora of information as well, and we'll share all that great contact information. All right. Thank you everyone for coming today, and we will hopefully see you tomorrow on day 2. Everybody enjoy the rest of your day.